regulations for public meetings in this format has changed. So this regular meeting of the Town Council is being held pursuant to Government Code Section 54953E related to teleconferencing of meetings. The Governor's proclamation of a state emergency is still in effect. The Town Council has made or will make the necessary findings under the law to hold teleconference meetings in this manner. Proper notice was given for this meeting. All persons are permitted to join remotely and address the Town Council directly. And the meeting will be delayed in the event of a town-caused disruption. This meeting will be held in all respects according to the requirements of Government Code Section 54953E. The town manager is present in his office, and I am present in the council chambers. Vice Mayor Dorman and council members Moeller, Dorenbecker, and Knight, along with staff, are participating remotely by video audio in conformance with Government Code Section 54953E. I will now ask Deputy Town Clerk Eddie Gomez to conduct roll and ask each member of the Town Council to respond to the questions of are they able to hear the proceedings and do they have a copy of the agenda for this meeting. Eddie.
Thank you, Mayor. Council Member Eric Knight.
Yes to both, and apologies, I'm having trouble with my background. I'm on my new laptop, so I'll be using a blur format, so thank you. I apologize.
Councilmember Dorenbecker.
Yes to both.
Councilmember Moeller.
Yes to both.
Vice Mayor Dorman.
Yes to both, thank you.
Mayor Dunbar.
Yes. Council members have indicated they are able to hear and have the agenda. So if you will formally roll, I think we can call that as the roll, Eddie, unless you feel the need to do it again.
Excuse me, Mayor, what was your question?
If we would just, for the record, all council members are present for the roll.
Are all council members? Oh, gotcha. I can start over again. Councilmember Knight.
Present.
Councilmember Dorenbecker.
Present.
Councilmember Moeller.
Here.
Vice Mayor Dorman.
Here. Mayor
Dunbar.
Here. See, we have a few extra technicalities when we're on Zoom webinar. We are all present. Just a couple more items. Members of the public may provide public comment via the following. As a Zoom webinar attendee and using the Zoom raise hand feature, and I will call on members of the public at the appropriate time. If their hand is raised for public comment, they'll have up to 3 minutes per public comment. The town or the public has also been able to submit to the town council by email at publiccomment@yville.com. And we do have some emails that have been received, and we'll be addressing those at the appropriate time. Via the e-comment feature in Prime Gov, which can be found as a speech bubble with the HTML agenda. Voting, before we proceed further, I'll just let you know that any vote taken during the teleconference portion of the meeting will be taken by a roll call vote by the town clerk. In addition, and new for this council meeting, public hearing and administrative regular agenda items that have representatives that are not staff will provide presentations as they would a typical council meeting held in council chambers and will be called upon to speak during their agenda item. So with that, we will go ahead and move forward with our meeting. Next item is Pledge of Allegiance. If you could all please face a flag closest to you and join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with the liberty and justice for all. Thank you. Next up is adoption of today's agenda. Is there a motion to adopt the agenda?
So moved.
Mayor, Council, I just need to remind everybody that we will be adjusting the agenda to take item 10B at 3:30 to allow at a confirmed time the Public Health Officer, Dr. Karen Relucio, to share a presentation related to your item 10B on vaccination. So that will be at approximately 3:30 or shortly thereafter, depending on the item you're working on.
Well, then that just gives us a target to get there by 3:30, doesn't it? Okay. I have a special guest that just walked into the chambers. This is, we're almost there. But I will entertain a motion to adopt the agenda with the recognition that Dr. Relucia, our public health officer, will be joining us at approximately 3:30, and we will move to that item when she is available. So with that understanding, Councilmember Dornbecker, motion, second by?
Moeller, second.
Moeller, thank you. Roll call, please, Eddie.
Yes. Councilmember Dornbecker,
Yes.
Councilmember Moeller,
Yes.
Councilmember Knight,
Yes.
Vice Mayor Dorman,
Yes.
Mayor Dunbar.
Yes. So I am going to just move a couple chairs very quickly before our next item. And you see I have put my mask on because we have a special guest in the chambers, and that is our outgoing retiring planning and building director, Sandra Liston, who is going to be leaving us after a very long and successful tenure here in Yountville. It's my pleasure to represent the council and present a proclamation and our traditional bottle of wine. Cannot drink it yet. You're still working, but if you would please come join me up at the dais. And I know we've moved this around before, so I'm going to do this again. Gives us a little more space. Okay, and I'm going to try to stand, let's see. If I go this way and you come toward me just a little bit. There we are. You can see us, right? Okay. So what I am presenting here is a proclamation in recognition of Sandra Liston, Planning and Building Director. Whereas Sandra Liston has worked for the town of Yountville for 14 years, starting as Associate Planner on September 17th, 2008, before being promoted to Planning and Building Director on January 7th, 2014. Whereas Sandra brought a wide range of education and experience with her to Yountville, including a Bachelor of Arts degree in Environmental Studies from UC Santa Barbara and a law degree from University of San Francisco, as well as experience in both the public and private sectors in Ymca. Whereas keys to Sandra's success are her strong writing style, the manner in which she drafts technical and legal planning information, and her straightforward presentations before the Zoning and Design Review Board and the Town Council. Whereas she was involved in the 2014 Town Hall Seismic Retrofit Project and led the effort to obtain historical designation for the Town Hall, which once served the community as Yountville Grammar School. Whereas accomplishments during Sandra's tenure include certification of 2 housing elements, the creation of climate action, bicycle, and pedestrian plans, and the nearly 2-year-long Envision Yountville General Plan update. Most recently, Sandra directed a multi-year ad hoc committee with council and Zoning and Design Review Board members to update the town's zoning and design ordinances to bring them into compliance with the town's general plan. Whereas Sandra has supported the Yountville community by guiding the development of several local businesses, including R&D Kitchen, North Block Hotel, RH Gallery, the JCB Tasting Salon, Stewart Cellars, Heston Vineyards, Handwritten Wines, and Priest Ranch Tasting Rooms, major renovations of the French Laundry Restaurant and Hotel Yountville, and numerous residential and commercial remodels. Whereas during Sandra's career, the town implemented process changes for various planning and building permit applications, created the employee parking management program, updated information and content on the town website, and created educational brochures explaining frequently requested planning and building information. Whereas Sandra participated in over 140 zoning and design review board meetings, and approximately 250 town council meetings. Some of those, as we know, late into the night, as well as meetings for the climate action plan, general plan update, and zoning and design ordinance updates. Whereas town staff and community members have enjoyed Sandra's positive, friendly personality while also watching her son Hudson grow from an infant into first grade. Now, therefore, let it be resolved, I, John F. Dunbar, Mayor, on behalf of the town council, staff, and the community, express our sincere appreciation to Sandra Liston for her many accomplishments and contributions to Yountville, and wish her and her family all the best in her retirement. Congratulations.
Yay.
So much. That was such nice
Oh.
work.
Well
Okay,
done.
let me do this. I'm gonna move it back over here so you can just speak directly to the camera. People can hear you
All
probably
right.
a little better.
Well, thank you, Mayor. Those were such nice words. It has been such a pleasure working for you and the rest of the town council over all of these years, working together to fulfill your vision and the council's vision for Yountville. I think that together we really have achieved a lot for the benefit of the community, and that's been really deeply satisfying, and I'm really so happy to have been a part of it. Yountville has a very special place in my heart. I love this community. And so the bonds that I've made with the town council and town manager Steve Rogers, my coworkers, and the community, so many of whom I call dear friends, is really just such an amazing exclamation point on my career. So thank you.
So before you get away, Julie, if we can get a photo of us up here. Steve, if you could stand on one side and I will stand on the other. And if you can have, let's hold this up.
All right.
See my face me.
Yeah.
Yeah, perfect. Got it.
All right.
Thank you.
And I think our town manager probably has something he'd like to say. Let me just reset this. But don't go anywhere, Sandra. Okay.
I think it's always you know, a challenging environment for us to put a honorary proclamation together, because it's always bittersweet, because in this case it means, in your case, retirement and a transition. But we also know that you're doing it with great intentions to spend time with your family. For those of you that also don't know, but it's hard to remember everything that a person's worked on or accomplished over 14 years. And with that, you know, it is a new transition. We're in that process. We wish you all the best. And we really, you know, we know you're not very far away, and you will continue to come up, and you'll continue to wander Yountville, enjoy our parks. Hudson is a big fan of Yountville Community Park. I know that firsthand. And our programs. And we fully anticipate seeing you out and about. But we do know that we were trying to get a note from the delivery truck drivers. They have shared with us, they are going to miss the amount of frequency with which they stop by. So with that, in all seriousness, we really wish you all the best going forward.
Thank you. Clearly an inside joke with staff about deliveries. Okay, we can get set back up here. All right. We are going to continue with our next item. And I'm just checking the time. We are okay. We have another presentation to make, excuse me. And that is for the Napa Emergency Women's Services, recognizing the month of October as Domestic Violence Awareness Month. And I see that Christina Gomez has joined us. Thank you for joining us virtually. I'd much prefer it when I'm able to recognize you in person, but we'll do it this way nonetheless. So what I will do, and then we'd like to hear your thoughts, Christina, after I read this proclamation, which I have here. And I will go ahead and read the proclamation in recognition of Domestic Violence Awareness Month. Whereas Domestic Violence and Sexual Abuse Services is commemorating 40 years of service to survivors of domestic violence in Napa County, having opened the first confidential safe house on October 5th, 1981, to provide safety for individuals escaping abuse. Whereas every year since 1989, the United States Congress has proclaimed October as Domestic Violence Awareness Month, renewing our country's commitment to standing against domestic violence and meeting the needs of survivors. Whereas domestic violence is a public health concern that impacts the well-being and success of individuals and our community as a whole. Domestic violence can cause severe physical and emotional distress for survivors, who are more likely to become suicidal and lose economic opportunities from the abuse. Children who witness abuse are likely to experience abuse themselves and are often used to control other family members, which can have lifelong impacts on their mental health. Whereas in 2019 and 20, Napa Emergency Women's Services, also known as NEWS, provided domestic violence and sexual abuse services to over 1,500 Napa County community members, with 84% of those survivors self-identifying as women, 55% as Latinx, and nearly 20% minors. Services included 24-hour response, assistance with protective orders, safety and shelter, permanent housing, financial aid, support groups, and children's services for issues related to violence in the home. Now, therefore, let it be resolved that I, John F. Dunbar, Mayor of the Town of Yountville, along with the Town Council, do hereby proclaim October 2021 as Domestic Violence Awareness Month and encourage all residents of Yountville to remain committed to supporting survivors and working toward the prevention of domestic violence among future generations. So I want to thank the Town Council for recognizing this month, and I invite our special guest, Christina Gomez from NEWS, to share a few thoughts. Christina.
Yes, thank you, Mayor Dunbar and Town Council. This is so special to us. On behalf of NEWS, I would like to thank City of Yountville for its recognition of Domestic Violence Awareness Month this October. As you know, this October commemorates our 40 years that we've been servicing Napa County. So this is a very special month for us, especially this year. Domestic violence affects so many in our community, and it is by both providing services to survivors and increasing awareness of the issue that we'll be able to break the cycle of intimate partner violence. But thank you so much for your support of NEWS and survivors across the Napa Valley. This really does mean a lot to us.
Well, thank you on behalf of the council. We know that you do this every day, not just during 1 month. And so thank you for all the support you provide, not just Yountville residents, but our entire Napa County community. Thank you to you and your entire team.
Thank you.
And thank you for joining us today. So Samantha, I'm going to check in with you. I know you were asking one of our attendees who has a hand raised. Do we know if there is a public comment on a particular item?
I do not know. There wasn't a response. So if we go to general public comment, Mayor, I'll just allow her to talk to make sure that she wants to not address something already on the agenda later on. Okay, very good. So we're going to do that now. We're going to move on to item 6 on the agenda, which is public comment on items not on the agenda today. I'll invite, I do see one hand is raised, and then I'll go to staff regarding any submitted comments. I see Francine Niddle. Are you raising your hand to speak to public comment on an item not on the agenda today?
Can you hear me okay, first of all?
Yes.
Okay, yes, I'm calling in to comment on an item that is on the agenda, 10B.
Okay, so hearing that, I will ask if you could just hold on until we get to item 10B, which should be just in a short moment. We're making a note that that's what you're, and if you'll, as we get to 10B, if you want to go ahead and put your hand back up on the participant window, and we'll certainly give you that time to comment. Any general public comment, Eddie?
We don't have any, Mayor.
Okay, so the public comment that has been received all pertains to specific items on today's agenda. We'll get to those comments at the appropriate time. Moving on to our item 7, which is our consent calendar. We have items 7A through F. If I don't.
And Mayor,
Yes.
we have an employment agreement on the consent calendar, and in accordance with California law, we must verbally identify the salary that will be offered. And this is for Kirsty Shelton, who has accepted employment as our planning and building director with a starting salary of $157,000.
Thank you. And I see that Kirsty has joined us. Thank you for kind of previewing your new job. And so in just a moment, assuming that we approve this consent item, I'll invite you to just introduce yourself. But thank you, Steve, for that. I will go ahead and entertain, I don't see any comments, so I'll entertain a motion to accept the consent calendar as presented.
Mueller moves.
Oh, wait, hold on a sec. Steve who was trying, everybody's talking at once. Was somebody going to make a motion or ask a question about the consent calendar?
Make a
I'm gonna
motion.
make a motion.
Okay,
Or second.
Councilmember Moeller.
I'll make the motion. We approve the consent calendar.
I'll second.
Okay, motion by Councilmember Moeller, second Councilmember Dornbecker. Everybody was very excited about making a
consent.
motion on the consent calendar. Seeing no other hands raised for discussion, I'll ask Eddie for a roll call vote on the consent calendar, please.
Yes. Councilmember Moeller,
Yes.
Councilmember Dornbecker,
Yes?
Councilmember Knight,
Yes.
Vice Mayor Dorman,
Yes.
Mayor Dunbar.
Yes. So those items pass unanimously, and now we can more formally welcome Kirsty Shelton to our team, coming back to our team after a few years checking out some other jurisdictions. But Kirsty, welcome back. Congratulations on your new position here, and just tell the audience and the council a little bit about your background and yourself.
Yeah, thank you. It's my pleasure to be returning. As Mayor Dunbar mentioned, I started my career 25 years ago with the town of Yountville, and Yountville was one of my main inspiration to both study land use planning and engineering. And I returned to the town as the planning and administrative assistant 20 years ago. So over the last 20 years, I've spent many years, almost 10 years with the County of Napa. I've been in public and private practice, and it is my pleasure to return. I share the sentiment with my predecessor that Yountville is a special place, and it's my pleasure to continue her legacy. And I really value both the council's direction and Sandra's leadership. So thank you for the opportunity.
Thank you, and welcome back. We do not have any presentations today. I see that we're at 3:24. I think we can try to begin the public hearing, item 9A. We may need to interrupt that if we have our public health officer join us. Gary, do you think it's, or Steve, do you think it's best that we start and then interrupt if necessary, or should I hold off on that item and go to a different agenda item?
I think you can proceed because this item could be relatively short, and then we'll work on getting the doctor in. It may be 3:35, but that way I think you can see where this item goes. And if it looks like it's going to be extended, then you can continue the item.
Agreed. That's what I was hoping you were going to say. So with that, we're going to go ahead and move on to our public hearing, item 9A.
Mayor, Dr. Relicio just joined us, just so you're aware.
Okay, well, let's hold off on the public hearing then. We'll jump to item 10B, which is an administrative item related to the potential vaccination requirements, discussion and possible direction by the town council regarding a policy for proof of vaccination for Yountville Community Center and or other town facilities. This, I think, will lead into Dr. Relucio with a brief explanation by town manager on why we are speaking to this item today. Steve?
Thank you, Mayor Council. This item was brought back at the request of council to allow for a conversation by the council and including the community with regards to consideration of a possible town-imposed mandatory vaccine requirement for town programming. The request was received both by the council and town staff, principally regarding some of our park and rec programming. Subsequently, there are also been some concerns expressed and shared by those that are opposed to such a requirement from the community. So the request by the council was to allow for broader conversation and also a request that we hear from Dr. Relucio. So today's session is really an opportunity for the council to have that consideration. If there is any direction that the council would like to do, then they need to provide that direction to staff, and subsequently staff will bring that back in the form of a resolution for action at a later meeting date.
Thank you, Town Manager. So I welcome Dr. Karen Relucio, who is our Napa County Public Health Officer. We've shared many Zoom calls over the last year and a half, but I appreciate you taking just a couple minutes to join us and speak to this issue. I also thank you for submitting some written comments that help kind of set up your thoughts and your position on this. So the request was to consider specific town-sponsored activities and events requiring not just a negative testing, but proof of vaccination. And if you could speak to where your opinion as a county public health officer is on that type of policy conversation, how it might pertain or not to individual activities, and also understanding a part of the request was based on some of our residents being in the more senior elevated risk, at least in the early stages of contracting COVID-19 and potentially having more severe consequences from that coronavirus. So if you could share your thoughts on this idea. We are aware that other jurisdictions have taken it upon themselves to mandate this type of thing, but I also understand those circumstances in some cases are very different in large urban areas as opposed to individual activities. And we know that some school districts are looking at requiring this, some employees are requiring it, business owners, et cetera. So if you could give us, if possible, a brief explanation of your opinion as our public health officer.
Yeah, I was just wondering if I could present just some data, and then also as I also would like to present what's already in existence by the state of California. And I'm hoping that might provide a little more insight as to what's going on with vaccine mandates. Is that okay?
Yes.
Yeah, so I'm gonna just share my screen here. Do you see a PowerPoint presentation?
Yes.
Okay, thank you. I just want to make sure. I'm just gonna give some updates just briefly of where we're at in community transmission and what kind of measures are being taken to decrease transmission as we are trying to get out of this Delta surge. So when we look at the CDC Community Transmission Map, Napa is in red. That means we're in the highest tier of transmission according to CDC. If you see our surrounding counties, the north of us, they're also in red, but to the south of us, which are Bay Area counties, they're starting to see decreased transmission into orange. And if we look at our case trends, our current surge, which is the third one on the right, if you look at the graphs on the right, it's not as bad as the winter, but it definitely exceeds last summer. And our peak this time had 1,100 cases in August, followed by 820 cases in September. And so far we have 35 cases in this first week of October. So this demonstrates the case rate among unvaccinated and fully vaccinated or fully immune population. So the top line are people that are unvaccinated, and then the bottom gray line are those that are fully vaccinated. So case rates in the unvaccinated are 10 times higher than vaccinated populations. So there is a difference in case rates. I'm not going to go through this, but all I can tell you is our estimates are getting better. Our new cases per 100,000 is down to 11.8. That's the best it's been in a while, but if we still had the blueprint for a safer economy in existence, we would be in purple. Our testing positivity is also going down. And part of the reason why I put in an indoor masking mandate in the first place was because of our hospital capacity. So we have less than 20% availability of ICU beds. That's one thing that is an area here where we just don't have enough ICU beds. And then these are just other indicators. So we're still seeing hospitalizations that exceed what we saw in the beginning of July with an impact to our healthcare system with both COVID cases, and then also people that present with delayed medical care because they had not accessed it during the shutdowns or for fear of COVID. And then if we look at our hospitalizations, I'm not going to go through this in great detail other than it's male predominant, mostly in whites, mostly in people that are age 65 to 74 years of age, and mostly in people with underlying medical conditions. This is where we're at with our hospital curve. We've exceeded last summer, and that also shows in our ICU. I'd like to bring attention to those that are hospitalized with vaccination status. So orange, anything in orange are people that are vaccinated. Anything in blue are people that are unvaccinated, and any gray in those bars are people of which the vaccination status is unknown. So you can see that, with our third surge, you could see that the number of people that are vaccinated that were hospitalized had also increased during this Delta surge. And then if we look at, the proportion of those that are vaccinated versus unvaccinated among those that are hospitalized, people that are being hospitalized, 31% are fully vaccinated, over 67% are unvaccinated or partially vaccinated, and then 1.2% are unknown. If we look at the ICU, over 78% are unvaccinated and over 21% are vaccinated. And just looking at deaths, if we look at, the most people that are dying, most of them are white, most of them are above 85 years of age, and most of them are in males. There is a difference in the average age of death according to vaccination status. So those that are vaccinated, the average age of death is 81. And for those that are unvaccinated, the average age of death is 72. And this shows the deaths by vaccination status. So, we had fewer deaths in May, June, and July, but of those that that died, they were vaccinated. And if we look at our biggest surge, which was in August, our peak, there were more that are unvaccinated that died as opposed to those that are vaccinated. But in September, you could see that it looks like more of our vaccinated individuals that are mostly of older age had succumbed to COVID-19. So, at this point, I just want to make it clear that, 85% of eligible Napa County residents are fully vaccinated, 90% are partially vaccinated. And what I mean by eligible is, those that are able to get vaccine according to FDA approval. That will expand probably in a few weeks as the 5 to 11-year-olds are are at the table for vaccination once FDA and CDC approve. So just to let you know, measures to try to decrease the spread of the Delta surge, it's pretty much the indoor masking mandates, because we still have the highest level of community transmission and hospitalization is still elevated. And then 68% of the total population is fully vaccinated. Here's where I would like to kind of bring attention to what's going on with state health officer orders for vaccinations that are already in effect. And I'm hoping that this information will help provide some context as you guys decide what you would like to do. So there's been a lot of health orders that focus the healthcare settings, high-risk congregate settings, and K-12 schools, where they require proof of vaccination or else they need to be tested at least once weekly if they're unvaccinated. And then this also has an impact on anyone who visits the healthcare setting, acute care settings, skilled nursing facilities, or intermediate care facilities, or residential care facilities for seniors. So they have to show proof of vaccination or proof of a negative test obtained 72 hours prior to the visit. And then any workers who provide services or work in facilities licensed by the California Department of Public Health, Department of Healthcare Services, or the California Department of Social Services must receive 1 dose of a 1-dose series, or that's Johnson & Johnson, or 2 dose of a 2-dose series by September 30th. So this includes my division, unless they have a religious or medical exemption. So the vaccine mandates really are applicable to the healthcare setting at this juncture. And then any workers that provide healthcare services at correctional facilities should also receive a dose of a 1-dose series or 2 doses of a 2-dose series by October 14th. So in the correctional facilities that got phased in, and their due date of getting vaccinated is going to be in mid-October. And then there was a more recent order that was targeting adult and senior care facilities and any direct care services worker, including home care aides and certified home health aides, all waiver personal care service providers, in-home supportive services providers, hospice workers, and regional center employees. And the exception, so they're required to get this to be vaccinated by November 30th. So they have to either get a single dose of Johnson & Johnson or 2 doses of Pfizer or Moderna by November 30th. And that was a mandate that came out from the state just a couple days ago. The only exception are those who provide services to whom of a person who they live with, or they're a family member of the recipient of whom they provide services. And then, as you know, there was an announcement by the governor on Friday that directed the state health department to add the COVID-19 vaccine to other vaccinations required for in-person school attendance, such as through health and safety code sections that are listed here. So then what is asked is that the state must add the COVID-19 vaccine requirements that applies to all pupils of any private or public elementary or secondary school, and it will be a condition of in-person attendance. Unvaccinated students may remain enrolled in independent study, but they cannot attend in-person instruction. And then school staff will be held to the same standard as students for the COVID-19 vaccine. And then once there's FDA approval for the vaccine for various grade spans of K through 6 and 7 through 12, then the students will be required to be vaccinated for in-person learning. And this is once there's full approval by the FDA, or else there's recommendations by the CDC Advisory Committee on Immunization Practices, or the American Academy of Pediatrics also recommends it. So it's anticipated that this requirement would apply to grades 7 through 12 starting in July of 2022. So, what I show you here is just the differences in case rates for those that are vaccinated versus unvaccinated, but I also wanted to demonstrate that there are also other state mandates that have already come down the pike. So just to let you know the position I'm at, I'm not interested in issuing vaccine mandates in this county. I have not done it because it's being issued by the state for specific populations, and I'm not planning to expand that requirement in this county. End my report.
Thank you, Dr. Relicio, for that summary. I did want to ask a couple of the initial questions. to clarify and put into context, in terms of the deaths that you reported and the age groups, what I have heard coming from your office, and correct me if I'm wrong, many, if not most, if not all, have underlying health conditions that at least in part were considered impacting their ability to survive COVID-19. So I wanted to make sure that you had a chance to clarify that, because we do have a senior population that lives here in Yountville in particular. It's a little higher than the average age in Napa County. And so there's a concern with some that senior population is at higher risk. But I want to make sure you have a chance to give the context of underlying health conditions as a factor in the deaths that you were just showing on your PowerPoint.
Yeah, thank you, Mayor Dunbar. That's correct. Most of our deaths are in those with underlying medical conditions. And I think that the other piece is that, the people that are dying of COVID-19 that have been already vaccinated are those that are older. And a lot of that is because they don't mount the same immune response to the vaccine as younger populations. So that has culminated in the recommendation of, booster shot by the CDC and the FDA, particularly those that received Pfizer, just because it was the first one to be FDA approved through the emergency use authorization, or authorized by the emergency use authorization. So that's the first one. And at this point, we're waiting to hear from the FDA for Moderna and Johnson & Johnson.
Thank you. And I want to follow up with another question to clarify some of the statistics and the concern as it relates to groups in activities. Because a lot of the data that I heard you present here, and I've heard for a year and a half now, frankly, concerned about the amount of time of exposure. That goes to restaurants, that goes to children in classrooms in school for extended periods of time. Even our park and rec programs had to make modifications based on having cohorts that only engaged recreationally with the same children, for example. So how do you, again, put context in the specific requests that we have heard from a couple residents and a couple members of the council that are concerned that small groups that are participating in town-sponsored activities, some indoors, some outdoors, might have an elevated risk if vaccines are not mandated? If you could give us some context on that.
Yeah, why don't I just kind of bring back, I think that before a vaccine was in existence, there were multiple measures that were put into place to decrease the spread of COVID-19. Of course, there was the, social distancing, which did lead to, closure of sectors of business, which is now not going to happen anymore. So there are other measures that could be used to decrease the spread. And so, for example, outdoor activities are safer than indoor activities. And aside, so that's one area. The other area is, you could wearing masks. If you're going to be in an area of close contact, and wearing masks decreases the risk of transmission, because the person wearing the mask, it blocks the virus from leaving them and going to someone else. So if you have more than one person wearing a mask, that is another area. And then the other, what was used before in the school setting was cohorts. So keeping people in the same groups, so that when it came to, managing, if somebody, tested positive, then the contact tracing is limited to a smaller group as opposed to a bunch of groups that are mixing together. So those were areas that were, allowed us to contain spread of COVID-19. So I'm not sure if I'm completely answering your question, Mayor Dunbar. Is there more that you need me to?
I will ask kind of a follow-up to that, because again, I'm trying to get to some of the very specific circumstances that we're considering here in Yountville. Can you apply data that you have collected to small groups of people that participate in activities, or do you need a certain data set that can verify an outcome? And meaning, if you've got 10 people in an indoor activity, can you analyze the elevated or not elevated risk of spread or infection in that small group, or do you need a larger set to analyze? That's kind of part one of the question. And are there activities, small group, medium group, large group, that are typical recreational activities that can be just as safe if we are asking for masks if you are not vaccinated versus mandating vaccines for everyone to participate? Hopefully I didn't confuse the issue with those questions.
Yeah, I think that, there are several factors. There's group size. So, the only, for example, if you have a very large group where you have an indoor setting, their larger venues are doing proof of vaccination or a negative test. But does that apply for every group? Not necessarily. I mean, I think that if it's an outdoor group that has a smaller number of people, then that type of, that's not something that you have to do. You don't have to do proof of vaccination or a negative test. So it's usually larger groups where this is something that, part of the state's guidance on dealing with mega events, which are greater than, I think it changed. So it's greater than 10,000 people in an outdoor setting. And I think it changed to 1,000 people in an indoor setting. Now I can't remember, but those are the groups where they really had to look at proof of vaccination or a negative test because it's a higher risk. If you're looking at like a small group of people that are doing an activity together, I'm just going to look at sports, for example. Contact sports are going to be a lot higher risk, right? So it's going, the highest risk are those that, people are tackling each other or wrestling each other. And if they're taken indoors, that is a much higher risk activity than something that's outdoors. So, but if you're talking about like playing bocce ball or something like that, that's outdoors, that's a lower risk activity. I don't know if I'm answering.
Yeah, thank you. The last question before I see that we have some council and members of the public also wanting to ask. So I heard you, if I just want to make sure I was clear that you do not anticipate mandating vaccination for, from a county public health officer perspective for what I'll call your jurisdiction, meaning county facilities, county activities. But there are individual business owners, there are individual event venues that are going further than your status and requiring vaccinations, which is their right to do. But you don't anticipate taking that additional step, correct?
Yeah, that's correct. So an employer or business can do that on their own.
Okay. I've asked enough questions for now. I'm going to go. I saw the first hand raised, Councilmember Dornbecker.
Thank you very much. And thank you, Dr. Reluccio. I was wondering if there are any stats so far on the deaths of people who have not only been vaccinated, but had the booster shot.
Since we just started giving boosters this week, I could safely say no, but the numbers would be very small because we've hardly had any people take boosters. I would say we probably had maybe 100 so far, and as recent as Sunday. So no, we haven't heard anything about boosters or deaths and people getting a booster.
I guess it was just very concerning seeing the stats about the deaths in the hospital of people who were fully vaccinated. Is there, or have you heard any information about when the Moderna and Johnson & Johnson booster shots would be available? I know a lot of people who've already gotten the other booster shot from Pfizer.
Yeah, so the vaccine related biological, it's a subcommittee of the FDA that advises FDA on approving vaccines. They're meeting on October 14th and October 15th to discuss the boosters with Moderna and with Johnson & Johnson. So it'll be next week. And I think there's discussion of extending the emergency use authorization for those vaccines.
And so I just reiterate, you are not you are not thinking that the county should mandate vaccinations or proof of negative test for events in particular venues.
So at this point, the only, I think that the state mandates already fulfill that function for higher risk situations. So, doing a local mandate on top of that is not something that I'm seeing as necessary to embark on at this time.
Okay, thank you very much.
And I just wanted to follow up one of Councilor Dornbecker's questions. I want to make sure that people understand the number of deaths that we have seen in ICUs are in many cases, and I don't have the stats memorized, but in many cases, very senior, elderly, and in some cases, end of life, and not just compromised immune systems, but end of life situations. So to see fully vaccinated individuals that have died, if my understanding, Dr. Reluccio, is if they had COVID-19, that basically was the cause of death as it related to the statistics, that they may have had significant underlying conditions, but if they had COVID-19, it was still considered the cause of death. Is that accurate?
Not necessarily. It depends on how the death certificate is filled out. So there are some people that get hospitalized for another reason, and it so happens they test positive for COVID-19. If the death certificate is saying that, they happen to test positive for COVID-19, we don't count them as a COVID death. But if they came in with clinical, compatible clinical symptoms like pneumonia, they don't have an alternate diagnosis, and they test positive for COVID-19, then we would count them as a death. And I think just to follow up on your point, Mayor Dunbar, about the underlying medical conditions, there are people that, basically, they were in the ICU and basically they didn't want further invasive treatment. They were put on comfort care to die peacefully.
Thank you again for the additional context. I think that's important. Councilmember Knight.
Thank you, Dr. Reluccio, for coming tonight and providing the information you did. I'm just trying to clarify maybe a question and a difference in my mind of one of the things we're discussing tonight is not mandating vaccines, as some people are concerned that they have expressed concern about us doing, but really for town-sponsored events, asking residents and residents and maybe primarily programs that have a higher senior participation to show proof of vaccination. So we're not requiring vaccinations, but asking people that choose to attend a program sponsored by the town. And while we all understand that the defenses from contracting COVID-19 are masking and social distance and being vaccinated, we have programs where people are playing bridge and they're sitting around a small table for an extended period of time. And we know sometimes masks aren't always working the way they should in terms of covering our full face. So I'm curious on your perspective of just the value of requiring proof of vaccination for programs that are focused on seniors spending a long time together in close proximity, and just even at best creating a comfort level if they know all the participants have received their vaccination, a proof of vaccination. I appreciate your thoughts. Thank you.
Yeah, so just the way that the mandates have worked at the state level as, you know, okay, so let's say somebody is not vaccinated or they don't have proof of vaccination, then the next step has been to, you know, show proof of a negative test. So, so that's, you know, it's usually you don't do one without the other unless you're going to completely exclude people that are unvaccinated from participating in the activity. So that's one factor. I think the other factor is that it does take, you know, just our experience at the county for HR to implement the vaccine mandate from the state, you know, for some of the divisions and departments in the county. That does take quite a bit. It does take quite a bit of record keeping and tracking of that. And then I guess it's also trying to figure out where does the area stop? Because then you're going to have to talk about employees, and it becomes a slippery slope, you know? So is it going to just be one area, or is it going to be all town buildings? So those are just some things to consider. And I think that, anyway, I think usually there's usually a concurrent testing that happens aside from looking at proof of vaccination.
Thank you. And just maybe one last question, Dr. Relucio. If you, in terms of your experience or talking, if you talk to other people in other communities that have maybe done selective proof of vaccination for senior programs, do you have any experience talking to people at other communities that are doing that or considering doing that?
I have not. I know that there are other jurisdictions, local health jurisdictions, that were looking at proof of vaccination or testing or proof of negative test, like in the restaurant industry or in bars like San Francisco, for example. I think there was a couple Bay Area counties that decided to do it for that setting, but I haven't heard of it for the senior setting.
And we are about to run out of time with Dr. Relucio. I'm going to quickly, for about 1 minute, Vice Mayor, if you could ask a question and provide time for Dr. Relucio to answer. She needs to be gone before 4 o'clock.
Thank you. Dr. Relucio, thank you so much for being with us today. After being with the supervisors, I was able to watch most of that. So thank you for double duty today. You gave us some written comments, and one of them is that if we decide to implement this, it will have a positive impact on overall health. In listening to your discussion tonight, it seems to me, and I would like for you to tell me right or wrong, seems to me that a jurisdiction or business can implement a whatever vaccine restriction it feels is good for its populace and constituents and residents. And it may be stricter than what the state or the county requires. Did I understand that correctly?
Yeah, that's correct. So any business or, you know, any event planner that wants to do that can do that.
And did I also understand, we've had some discussion about what you would do or you foresee that you might or might not do and what the state is doing. It seems to me from the discussion that some of the things that we are not doing here in Napa County are because the state is already doing them.
Yeah, that's correct. And it's focusing on specific sectors.
Great. Thank you very much, Doctor.
And Dr. Relucio, I want to thank you very much for spending this time with us. I know you have a hard stop in about 10 seconds. So appreciate that. We're going to continue our conversation. I know we have some public that want to comment as well. Thank you very much for all the information and for the support you've given our community for not just the last year and a half, but especially the last year and a half. Thank you.
Thank you very much.
And I'll go back to the Vice Mayor. Did you have any other comments you wanted to, or questions you wanted to offer the council before I go to Councilmember Moeller?
I do have some council discussion, Mayor, but I don't have any further questions.
Okay. Well, I'll give Councilmember Mueller an opportunity, and then I know we have at least one member of the public that wanted to comment, and then we'll continue. Councilmember Mueller.
Yeah, I just have some, summary comments. I don't really have any questions at this time, Mayor. Thank you.
Okay, then I want to shift over so that we don't lose the opportunity with our member of the public, Francine Niddle, who had her hand raised before. I see Anthony Pilati also, but we'll go with Francine first and then go to Anthony.
Yes, thank you very much. I'm new to Yountville, so this is the first time actually attending one of your city council meetings. We previously lived in Napa, and I was just at the Board of Supervisor meeting this morning. So I heard Dr. Relucio speak this morning. I'm going to not actually read what I have written. I'm going to read the first paragraph about why you are not holding in-person meetings. But I would like to say something to Dr. Relucio. That was the first time that I've heard her say loud and clear that she is not going to enforce any kind of mandates. So I've been listening in on Board of Supervisor meetings, city council meetings, ever since this pandemic began. And that was the first time that I heard her express that. And as a person who is 100% anti all mandates, especially mandates requiring proof of the shot. I don't call it a vaccine because it is not a vaccine. I was actually very pleased to hear her say that. One thing that struck me, and I was actually kind of chuckling over here, was your hypocrisy. I heard you talk about small groups gathering, which would imply locals, I'm thinking, community centers. You were talking about the elderly population, which Mr. Knight, isn't it up to the elderly to decide for themselves how to make themselves comfortable? It's not up to you to tell them how to be comfortable. But not one time did any of you address all the thousands of people that come into Yountville every freaking weekend. Nothing. You guys are talking about implementing discriminatory things against the people that live in Yountville because it's such a great concern, the small groups gathering, oh, the bocce players. But you did not once mention all the thousands of people that descend into Yountville every single weekend and go to restaurants and wineries. Unbelievable. It's seriously unbelievable to me. So the first paragraph I wrote, and I'm wondering why the Board of Supervisor meeting this morning was in person. We were able to go into the chambers with the mask on, of course, and socially distanced, but why you cannot have in-person meetings. I'm curious about that. So this is what I wrote.
Okay, so I'm sorry, I'm going to interrupt you because we're talking about the policy about vaccine mandates. We're not talking about in-person meetings. So if you could, you've shared your comment about the topic that we are discussing. We have not actually finished our discussion as a council. I invited you and other members of the public to share your comment. So
okay, so thank you. I guess what I just have to say is I'm not alone. There are a lot of citizens of the Napa Valley who are very, very opposed to any and all forms of vaccine mandates. We're not going to be silent about this at all. We will never be silent about it. This is our choice. We have medical freedom. Again, I am thrilled to hear Dr. Relucio say that she will not be enforcing this. I do agree that businesses, as a business, sole proprietors have the right. But this is not cool, and I hope you guys make the right decision. And next time, maybe talk about the thousands of people that come to Yountville every weekend.
Thank you. Mr. Pilati, I don't see your hand raised. You had it up for a moment. So I'll assume that you do not want to comment at this time. Sherry Sawren, and I'll just remind folks, because we have some names that we have not typically had on our meetings. We do limit public comment to no more than 3 minutes. So, and it must, you do need to speak to the agenda item being discussed. So Sherry Sawren, please.
Hi, good afternoon. Are you able to hear me?
Yes.
Okay, thank you so much. I just wanted to say, I was also very happy to hear what the doctor had to say about not mandating vaccines. I am opposed to mandating people showing their card at restaurants and events. And I was really happy that she mentioned about the death with the comorbidity, the elderly, people that were old and had issues already, which happened to be the majority of the people. I kind of would like to see, statistics on people that are healthy, fit, proactive, not doing meds, things like that, because that would kind of make it nice for other people to realize that there are a lot of people out there that do have a natural immune system, and a lot of people that have antibodies from having COVID already. So, and there's been a lot of studies on that, and they're still ongoing. But, as far as like get-togethers with friends, family, groups, I think we're all grown adults, and people choose who they want to be with, whether they're vaccinated or not vaccinated. And we take our risks as friends and family when we are together. So I just don't like the fact that it seems like sometimes people are pitting the vaccinated against the unvaccinated. People are afraid of each other. And I mean, there's so many other studies other than the one that the doctor showed about a lot more people, especially the Israeli study, getting COVID after they're vaccinated, especially the Delta variant. But, I really wish that maybe we should focus sometimes on people that are healthy and, don't have these comorbidities, because there's a lot of us out there. And, if you're exercising, eating right, doing the right things, we have a healthcare system that we're paying for the people that don't take care of themselves. I know people that have had heart attacks and they have a stent, and I see them drinking their Diet Coke and smoking their cigarettes. I mean, I can't be responsible for that. And I just feel like sometimes people don't understand we all have to take responsibility for ourselves. And whether you want to be healthy, fit, or not, those are your decisions. And I'm not judging you, but I don't think the healthy should be penalized. So I am totally against and opposed to showing any kind of vaccine card.
Okay, thank you for your comment.
Thank you.
And
thank you.
I do see Mr. Plotty has re-raised his hand. So you're up next. You have 3 minutes.
Can you hear me?
Yes.
Okay. So I'm vehemently opposed to any and all mandates. I believe that freedom is our choice and we should have the ability to make that choice. I understand it is our duty to protect our children and our elderly. I don't see how this shot is doing either. In fact, I think it's the opposite. And as someone who is naturally vaccinated, meaning COVID recovered, I think it's absolutely very important that we recognize natural immunity, as it is far more protective than synthesized immunity. And that is shown in a number of studies. So if you are to move forward, which I hope you do not, and I am again vehemently opposed to it, but if you are to impose some sort of rules for, separating society citizens into two classes of people, I would suggest that you include the class of naturally vaccinated and naturally immune, as it's more effective than these shots. You can look at the studies. I'm not going to go through. I'm not a scientist. So I'm not going to go through the science with you. I believe that you all have sound minds and you can do that on your own. But this is totally contrary to science in my perspective. And we need to be actually looking at these facts clearly and not through a political lens, which I believe this is all a charade. You look at who's dying. You look at who's getting sick now. You look at the facts, and they matter. So, again, I'm vehemently opposed to any and all mandates. I think it's a bodily autonomy thing, and we all have choice to make our own informed decisions. And if we do not have the sound mind to do so, then there's, avenues for that. But I believe that we all do have the sound mind to do so. So, completely against it. Just look at the science, and I'm just going to say, please don't do it. It's just not right.
Thank you for sharing your comments. Appreciate all of our public comments being respectful of a position that clearly is sensitive and personal to a lot of folks. So that's very much appreciated. I don't see any other attendees wishing to comment, so I'll invite council to continue the discussion. I know Councilmember Mueller, you haven't really had a chance to weigh in.
Guess I'm unmuted. Well, thank you, Mayor. I would like to provide some background information that informs my thoughts on this topic. With no ability to test for the virus in the early months of this pandemic, we had no way to really estimate the total infected population. We were really limited to contact tracing of individuals who had symptoms. And now it's been estimated that up to 40% of infected individuals had no symptoms. And this is, I think we've all heard the term, this is called asymptomatic disease with COVID. So that background is why this pandemic blew up on us in the beginning. All of a sudden it was in the nightly news, and we didn't even, a lot of people weren't aware of where it came from. With positive individuals who are asymptomatic, we're also spreading the virus, but we were totally unaware because we had no ability to test. Now we have very good, very prevalent, very reliable tests. When the vaccines arrived, we began to have hope that this pandemic might end. Hospitalization and death for vaccinated individuals has dropped significantly. Then came the more highly contagious, faster replicating Delta variant. It is with us now. And we heard from our public health doctor that we are turning the curve on this, and I watch the numbers very closely. But we've also all heard about breakthrough cases in vaccinated individuals. While a few get sick, and there have been some deaths, most vaccinated individuals with breakthrough cases are asymptomatic. And my point here is they are asymptomatic, there are still breakthrough cases, and they can still infect others. Vaccines were not designed to prevent exposure or transmission of the virus. That is why wearing masks, socially distancing, and getting tested is so important, for people who decide to do indoor activities. And this is primarily due to airflow and filtration being different than what's outdoors. So after you get COVID or a vaccine, you do have antibodies that neutralize the virus. But antibody levels, as we're hearing on the news, can drop over time. So that's why the FDA and the CDC are now approving booster doses. So my point is that when we really, consider all this, that, vaccines, while they've been a tremendous breakthrough, they're not an armored shield. And we really must remain, diligent, vigilant, and careful. And to me, banning individuals who have been vaccinated from the community center is just too simplistic to really take care of our overall health. I really wish eliminating this viral pandemic and breakthrough cases was really that simple about banning people, but it's not. We should not, in my opinion, marginalize the children who are not able to get vaccinated, from entering the library or our community center, or perhaps, the public when the council does move to live meetings, or someone entering town hall who might need assistance from staff. And training staff to oversee a new mandatory vaccine health policy. That's not a simple procedure either. There's needs to be a lot of record keeping. There are privacy issues because these vaccine cards are medical records. There could be requests for exemptions or figuring out how, our staff is going to ascertain whether a COVID test, you take it 24 hours, 15 minutes, 72 hours. There's a lot of different possible legal and other compliance issues with, us trying to do this. I believe we need good health guidance for our community. We don't need to start pushing them away. Napa County has, we heard just in Dr. Ruggiulio's presentation that Napa County has been fully vaccinated, over 85% of its residents. And if you add in neutralizing antibodies that you would get if you did get COVID, this number is probably even higher. And children 5 to 11, this is really coming up very soon. There's going to be a lot of discussion. I think that date with the FDA and the ACIP is October 24th. So they're going to be able to get vaccinated soon. This is going to also raise our vaccination rates. So the County of Napa, the town of Yountville, and others have really done a great job, in my opinion, holding vaccine clinics, providing testing opportunities, instituting indoor mask requirements and social distancing. And these non-pharmaceutical interventions, masking, social distancing, and testing, they're working. The high vaccination rates are working. We should, in my opinion, maintain our focus on what we are currently messaging and following Napa County health policies as we have been this past 18 months. And I think our town resources and time will be more wisely spent in continuing these efforts rather than getting sidetracked by instituting new mandates for public facilities in town. My closing statement, we all need to remain cautious and vigilant as we re-enter society. Thank you.
Thanks. And before I have further council comments, I want to acknowledge that we did receive about 5 or 6 written public comments submitted by email. Eddie, I wanted to have you present those for the record, please. There was one that was received very late, just before the meeting, and the others were received a bit earlier.
We did receive one more, Mayor, just now. So I just saw it in our email, public comment email. So I'll start with Carol Fink. She says, "Dear Mayor and councilors, I remain as confused as many by all the information coming out of the CDC, local health departments, and the state. But one thing that does seem clear is that despite being fully vaccinated, we still need masks and social distancing to both keep ourselves safe as well as to not spread the disease to others. It seems a false sense of security to think all we need to do is get a shot. Yes, there are the most important things we can do, but not the end of keeping each other safe. Thinking about bridge players in the community center, I don't believe the 6 feet apart is doable at a card table. So masks make sense as well as being vaccinated. Truly playing in open air or at someone's home is probably safest, though I still feel the need to only have visitors who have been in my bubble. All this is indeed so confusing to me, and perhaps Dr. Reluccio can shed further light. Many thanks, Carol Fink. The next one is from Rob Peterson. Mr. Dunbar, I want to strongly discourage you and the City Council from implementing any proof of vaccination requirements for any town-sponsored activities and events. As you and other council members well know, this town survives on tourism. And with the devastating impact the coronavirus has had on this town for over a year and a half, the additional imposition of unnecessary proof of vaccination requirements on town-sponsored activities and events will further adversely impact the very community you were elected to support. This is totally unwarranted and unnecessary, and is more COVID theater than promoting public health. It's been the citizens of Yountville that have stepped up and supported local businesses and events over the last year and a half. Impose this sort of heavy-handed government imposition, and the fabric of our community will tear asunder. We, the citizens of Yountville, will work against any member of the council that supports such jackbooted requirements.
I did want to, before you go on to the next one, I did want to recognize that Rob Peterson submitted 2 emails, but they were very similar in his opposition. We only have one listed here, but there was a second in the series, but again, very similar message from the second one. So go ahead, Eddie.
Mm-hmm. The next one is from Cynthia Key. And she said, I am writing to express my strong objection to the imposition of a vaccine mandate. The decision to impose such a mandate is not only a serious encroachment of personal freedom, it is scientifically unsound. Cases/deaths in the county are low and declining, and vaccination rates are high. Those that wish to be vaccinated can do so. Fact, the vaccinated among us do not need protection. Fact, the unvaccinated can vaccinate or assume the risk. Fact, the unvaccinated do not need an additional level of protection that involves denial of my free medical choice. We have gone for over a year with folks dining in crowded restaurants without masks and without vaccination. This overreach is utterly without justification. If we have such a profound belief in masks, why now is that no longer sufficient? In the law of diminishing returns, the abridgment of personal freedom gets you very little in the current COVID risk environment. The imposition of vaccine mandates results in denial of services, benefits, and public and private resources to members of our community that maintain a sincerely and thoughtfully held belief that the risk-benefit analysis related to the vaccine tilts too far in the risk direction. Many believe this is all political. This is not political, as you can see from the broad cross-section of society, including health professionals that have chosen to wait. My strong objection to vaccine mandate is based on my right to determine how and when to accept medical treatments for myself and my family. Moreover, public figures continue to insist on make decisions for me and my family, while hypocritically flouting their own requirements. These mandates are an utterly abhorrent assault on my personal freedom. Members of our community that are concerned about their health are free to vaccinate without the need to abridge my personal choice in declining the vaccine until more is known about its potential side effects. The unvaccinated do not need the level of protection that abridge my free medical choices. I urge you, do not pass this mandate. And Mayor, I just want to make a note that there's 3 other emails that are similar to that one. The next one is from, give me 1 second, please. From Matthew Raymond Hopper, very similar with slight changes on stating that masks work and why is a no more widely enforced practice no longer sufficient. And I believe it looks like those are the only 2 that are very similar. The next one is from Carla Yates Rafe. And it states, I just heard our president address the nation urging seniors to get vaccinated against COVID-19. The state of California and the scientific community joined the federal government in closing in on this pandemic against the unvaccinated with the hopes of ending this scourge once and for all. The president thanked businesses and local governments for helping solve the problem by requiring vaccinations. I understand the town council is considering a resolution/ordinance to require persons partaking in park and rec sponsor activities to be vaccinated. Golden ticket, senior citizens may choose as the focus of interest as these people are the most vulnerable in our community. This seems like a sound idea within the town scope of the authority and would put Yountville in a leadership position in the valley with respect to protecting its senior citizens. Such a resolution should not be difficult to enforce and will require no extra staff. A visual check of vaccine cards at the time of registration or the first meeting of a class, or upon embarkation of a bus during the rare bus trips should suffice. Large outdoor activities such as parades, movies, and music events could be exempt. Our bridge groups started up in May and consist wholly of seniors, including quite a few veterans from the Hill. All of us are vulnerable and all of us are gladly showed our vaccination cards to get into the weekly sessions. There were no problems. We all felt safe because of this requirement. Staff was helpful. The bottom line, if you're not part of the solution, you are part of the problem. As the president says, do the right thing. Thank you for your consideration of my comments. And the last one that I have is from Jack Forcellani. I am resident of Bella Vista Mobile Home Park. Oh, sorry, no, that's related to the overlay.
Okay. Yeah, I believe those were all that you submitted to the council for consideration, plus the most recent one that was received. So thank you, Eddie, for reading all those so that we can get proper perspective on the public comments. So I see Councilmember Knight, your hand is raised again.
Thank you, Mayor. It's a difficult issue, but I just feel like at some point we need maybe come back and have some clarification about what we're talking about. A number of the comments from people tonight are upset with their feelings that we're mandating vaccines. And I feel that this conversation, now there's a number of issues that at some point we may talk about. I mean, in terms of, there's an issue where the town manager may at some point have an issue of mandates for staff. But what we're talking about, it seems to me tonight, is people that choose to attend a program, choose to enter a facility, not that they show proof of vaccination. So it's a choice on their part if they want to be involved in the Golden Ticket program. And so I appreciated Councilmember Moeller's comments, especially since you're involved in the work, trying to eradicate COVID-19. And so I'm really curious in terms of your perspective as we talk about this. Do you see a value in terms of as Carla Rife said in her letter, in a program where people are participating, where they're in a small room, sitting around a small table inside, they are masking, but they're not able to social distance? Do you see a value for the council to ask those that choose to participate in that program to show proof of vaccination?
So, I'll be controlling who's going in what sequence here, Councilmember Knight, and I'm going to ask you a question. If you are saying that you are not supporting a mandate for vaccine, what is your response if somebody wants to participate in a recreational program, does not show proof of vaccine? Are you saying that person cannot participate?
Well, we're talking about a program. Again, it's getting very specific to what we're talking about. Are we talking about outdoor programs? Are we talking about inside programs? Are we talking about a senior population that are participating in a program in a small closed area? At some point, if we were talking about proof of vaccination, it may or may not include then showing proof of a negative test within 72 hours. It's certainly something that Dr. Relucio talked about. I'm talking about people that want to choose to participate in a program where they know they're going to be around other people that are a part of our senior population, and just a comfort level for everyone in that group that while people are masking, that they have some comfort level that the people that they're sitting across the table with have been vaccinated.
Well, you did
it doesn't prevent them necessarily from being infected, as we know with people that have been vaccinated, but it's a town-sponsored event. What's our responsibility to those that want to participate in a program that are older to have some level of knowledge that that people there that are in that group are vaccinated and have at least have done the first step of defense against contracting COVID-19.
I'll try to ask my question again because I don't think you answered it. Are you turning away someone that wants to participate in a recreational activity sponsored by the town? Are you turning that person away if they either refuse to show proof of vaccination or are not vaccinated? Are you saying that person gets turned away, regardless of what the program is, indoor or outdoor? Because you're asking us to consider mandating vaccinations for recreational programs sponsored by the town. So are you prepared to turn away people that either choose not to or do not have a vaccination card?
So the way I think it's the way I would phrase this is someone choosing to want to participate in a program like the Golden Ticket program. Should we require them to show proof of vaccination? They can not choose to participate. They can not.
I'd like you to answer my question. I'm sorry to interrupt you, but you're refusing to answer my question, which is, are you turning away someone who doesn't show proof of vaccination? And if so, are you asking town staff to now police that at every recreational program?
Not every recreational program, Mayor. My focus is primarily on programs like the Golden Ticket program.
Okay, let's say Golden Ticket.
So my question is,
let's say Bridge. So let's just say Bridge, hypothetical. That's what Carla Reif brought up, Bridge in particular. They don't want to wear masks. They'd rather be able to sit there without masks and know that everyone's vaccinated. Are you turning away a resident who cannot show proof or chooses not to show proof of a vaccine? And if so, whose responsibility is it to turn that person away? Is it staff's responsibility? Because they're not public health experts. So I'm just asking, is that the scenario that you're proposing? I was just trying to make sure that it's clear what you're asking.
Well, in this discussion, at every point we're talking about this, and it's difficult, is you're telling me that in terms of what Carla Reif was saying is that they want to participate in a program and not wear masks. So that's new information for me in this conversation. I'm assuming that when the town is following state and local guidelines, that when people enter a building, that they are wearing a mask.
So regardless of whether they want to wear a mask or not.
So you're saying that they are not. So
no, don't worry. I'm sorry. I should not have sidetracked you about the masks. Are you saying if someone can't prove vaccine, whether they choose to prove it or not, if they can't prove they're vaccinated, you're saying they cannot participate? Is that correct?
Yes, that's what I feel, that we're talking specifically about a program for seniors, not across the board. I think it's something we can talk about with the town attorney if we can be selective on programming, but that we're looking specifically at programs like Golden Ticket.
Okay. Did you have anything further? Or I know Vice Mayor Dorman's had her hand raised, or shall I?
Just that I was interested in Councilmember Muller's thoughts about that, about a response to a specific program like the Golden Ticket.
Wait, Councilmember Muller, and then I'll go to the Vice Mayor.
Okay, I'll answer that. Again, I was trying to make a point a couple times. It's really not that simple. If you have a Golden Ticket program, you're in the community center. And, are we talking about one specific card table with one specific Golden Ticket program? There are Golden Ticket programs in both the new community center and the old community center. If you're going to really, have a Yountville specific mandate policy for involved in Golden Ticket programs, it has to be encompassing. I don't see how you can say these people over in this corner of this room you have to have proof of vaccination, but somebody who's over here may not. I just don't see how we would ever or should actually set up a distance requirement or all sorts of things. You just can't. This virus is out there. Somebody could be breathing, someone could be not wearing their mask correctly. It's not really, we can't just draw these imaginary lines around certain groups of people that say, you're okay, this virus isn't going to go here. That's why these things are, if you want to do it, difficult and complex and really have to be thought out. It's not simple. And then you've got people who maybe say, well, I'm not vaccinated, but here's my proof of a negative test. There are lots of different negative tests out there, and some events it's kind of like when you get your first COVID shot. Go here's your test. Take your test. 15 minutes later, you can come in, or 72 hours. 72 hours is a general guideline, but someone could have gotten infected that the very next day. You don't know. That's why these things are complex. And if we're going to craft something, we would be well served, really, making sure that we knew what we were talking about and what we think we're doing before, we then try to explain it to the public. So again, I think that there might be some people who thought this was a good idea, but I think from this discussion, we're going to see it is complex. And there are a lot of opinions on both sides, but overall, my summary is things are working. Everything we've been doing has been working. And I was just really trying to make a point about, asymptomatic cases. These are breakthrough cases. They were really what caused the pandemic to blow up in the beginning, and they're still with us now. And this education piece, to me, is much more important, answering questions than, satisfying, that, maybe a very simplistic perception of something. So I'll stop. I can go on forever, but I won't.
Okay. No, you won't. Vice Mayor?
Thank you, Mayor, and thank you, Council, for the discussion. Yes, everybody has an opinion. There are facts, there are opinions. Everybody knows some facts. Everybody's got opinions for sure. The 5 opinions that matter in this are the opinions of this council. And those opinions must be based on fact, but they must also take into account that part of our charge is public health and safety. I don't agree that it's as complex. Yes, oh my gosh, come on, I'm a retired lawyer. I could take a soda straw and make it the most complex thing in the world. Or I could say, gee, do I want to drink out of a glass or do I want to drink out of a straw? That's kind of where I think we are now. And I'm sorry, this discussion has, we've been all over the board. Many of the people we heard from, I so appreciate our public weighing in, but that's not what's before us tonight. I'm the one who asked for this on the agenda. I drew it very narrowly. I drew it to say indoor golden ticket because and I'm one of them, is an at-risk population. Dr. Reluccio showed us the figures. You're 10 times more likely to be a case, to be a reported case if you're not vaccinated. 67% of the people in the hospital are golden ticket age. Our ICU beds are down. People are delaying medical care, which also impacts our senior community. Not only our senior community, that impacts all of us. If you look, Morimoto is having proof of vaccination. La Tote is having proof of vaccination. San Francisco, West Hollywood. People who mention the tourists, that's for another day. I am here tonight about our senior population. I have heard from a lot of residents who didn't, for whatever reason, comment tonight and didn't send in an email. So, of course, I'm going to put that into my calculus as I continue to consider this, as we continue to discuss. Inglenook, a well-known winery, you have to have proof of vaccination to go in and taste. The bridge that we talked about, I happen to know that every one of them was, I don't really know the verb, but every one of them had to show a vaccination card before coming to that table in our community center. Now, whether that was a one-off, I don't know, but that's what happened. Hotels are saying, not only am I proof of vaccination on my guests, I'm saying anybody who comes in my lobbies. Colleges and universities are recommending it. And I understand those are different from us. But I think the fact that those venues are doing it makes it even more impressive that we are considering doing it for a population that clearly is at risk and clearly has a greater, once exposed, there's a greater problem to it. I don't think that this is a case of choosing who we want to be with. This is a case, yes, I can say to my friends, I'm sorry, I'm not going to break bread with you unless we're all vaccinated. When I go into a golden ticket class for wine appreciation, which I highly enjoy, we are not 6 feet apart. And often by the end of that class, some people are not wearing their masks. So if you want to talk about the staff resources for enforcement, this is not a case of you either wear a mask and you distance or you get a vaccination. This is saying, let's be prudent. Let's get a vaccination and let's continue to wear our mask in case somebody slips up or in case we don't have room to do distance. You know, honestly, it's been a great discussion. I don't still know how I'm going to vote, but I do think it's not that difficult. It's what we are put up here to be policymakers. We have heard from a lot of people tonight. I happen to know that some of them are not residents of Yountville, and that's fine. I take their counsel just like I take a resident's, but I am interested in protecting our residents. And with that, I will step off my soapbox for the moment. Thank you for indulging.
Thank you. And I just want to make it clear that all 5 of the council members care about the health and safety of our residents. So it's not about whether you're supporting a vaccine mandate for a golden ticket or not. So let's be sure that that's clear. But I would also
that,
add,
Mayor, I did not mean to the contrary. I was simply saying that as the decision makers, we all take that into account.
And what I'm going to offer is, for a year and a half, at least, we have been following Napa County's public health officer guidelines throughout this pandemic. And I feel it's appropriate we continue to do so. That's the very simple explanation for how I'm looking at this. Dr. Relucio is a public health expert, and she commented today, and she has spoken for many, many months to the Board of Supervisors, basing her decisions and her recommendations on statistical facts. The vaccine has taken on, similarly to mask wearing, it has taken on a challenging, if not political, dynamic, but it's taken an even additional dynamic from that, which is about people and their public health, not public health, their private health, and a requirement to show proof of a vaccine to participate in publicly sponsored activities. It's different, in my opinion, than private businesses who are choosing to require patrons of their private businesses or private events to be vaccinated. So I have been to Loto and appreciate that they are requiring their patrons. Part of it's to keep their employees safe. They require their employees to be vaccinated. That is their private business, their choice. They know that they are losing some patronage from those that don't want to come in because they don't want to have to prove their vaccine status. We as a public entity, I believe, have a different consideration before us. We are being asked to consider having different rules for different sections of our community, and I'm not comfortable with that. None of us want elevated risk of exposure to COVID-19, regardless of the age of our residents. There are young people with underlying health conditions that would not be protected the same way as a group that mostly, if not entirely senior age, that participate in the golden ticket. How are we to decide, when we are not public health officials or doctors, which of our population is supposed to get the extra attention and extra protection by having vaccines required for this activity, and then not the one that involves other people that are a slightly lower age? I don't think that that's our role as public officials in using public resources. So I do think there is a difference between private business and public activity. So I see Councilmember Dornbecker, you have your hand raised again. I'll pause so you can comment.
Thank you very much. I appreciate that. This issue is as charged for us as it is all over the country. And I understand that, for example, I believe that the people who belong to the Bridge Club made the decision together that they wanted people to be vaccinated and ascertain, show that they're vaccinated. And I believe that that's all right. If there's a group of golden ticket people who want to have a group and work and play together on a specific basis, why don't we encourage them to make that decision as a group? But I personally feel that the state and county guidelines are the ones that are working for us, and that rather than make mandates for specific segments of our population, if we're not going to make a mandate for every every business and in Yountville, then we can't possibly protect everyone. So I think that it would be better if we stick for now with the state and county mandates that are in place, and that we encourage, if a group of seniors who take part in the golden ticket program want to have in their specific club, that everybody in that club needs to have a proof of vaccination. Well, that's one thing, and I think that that's totally permissible, and we should applaud them. But I just don't see that making a mandate at this time for one specific group, the elderly in this town, is really doing our duty. So that's how I feel about it. Thank you.
Thanks. I'm going to ask Samantha to share your thoughts, because you did share some when we spoke to this item a couple of weeks ago, and you have a perspective in terms of operating these programs and have a broader sense of the participants and how these dynamics are playing out and how that would affect staff. So could you share that comment? I think it would help the council.
Wanted to make a point of clarification, which around the Bridge Group and that requirement of vaccination. The Bridge Group asked to resume meeting much before we were reopening to the public. So in order to facilitate that, because there wasn't public guidance readily available, I sought guidance from our health department on how we could do that safely. They told us that the way they would recommend at that point we do that safely was to verify that they were vaccinated and require masks. So that was way prior to us getting further reopening guidelines, because as you know, over the last 18 months, things have changed and changed and changed and changed again. And my staff and my team has done everything we possibly can to get those services back out into our community and get people together again, because that's also a health issue. This isolation is a health issue, especially for our older population. And so I just wanted to lend that point of clarification, is that we were asked to try to find a solution, and we found a solution. And then we received further guidance on how to reopen safely from the state of California and the county of Napa, and we continued down that process, and the process did not include requesting vaccination records. So I just wanted to clarify that. As far as how we would implement this, like with everything that we do, we would figure it out. I think it's definitely less manageable in my mind. It leaves a lot of gray areas if we're isolating this to one specific thing. For example, the Bridge Group is not a golden ticket class. That's not included in the golden ticket program. You can be in both, but you don't have to be a golden ticket member to come to Bridge. So if you say just golden ticket, that's really not encompassing the population. I've shared my concerns. We are an open community center. We're also adjacent to an open library. We serve all ages of people. And so I think that, you know, it definitely, we've had that conversation with some of our participants that it will not alleviate the mask requirement, because I think that's something that's out there, that people think that if we require proof of vaccination and everyone in the room is vaccinated, they won't have to wear a mask. And that's not the current mandate from the county of Napa. So, you know, we will find a way to implement it, but I think that, you know, it's definitely going to be an issue, because what we're experiencing right now, and something that Vice Mayor Dorman noted, was we're really babysitting classes to make sure that people are doing what they should do. And these are adults. So when we have to come in at the beginning of every class and give you instructions on how to properly wear your mask, that's what we're currently doing. And so I think that that will only escalate. And it gets to the point where you're really, you know, you're on this thin string. And I don't want to sound pessimistic, because getting our residents back into the center and giving them the services and making sure that they are communicating and getting out of their homes is what we are here to do. And we would never do that if we didn't feel like it was safe, but everybody has to contribute to that safety, you know, and we're doing everything that we can to try to encourage that. And as adults, you would hope that that is something that, you know, would be easier to do. I feel like verifying vaccination status could potentially become an issue for us, as far as people who don't want to share that information, as far as people who may not be vaccinated or have a hard time, you know, finding their card or things like that. So, you know, but then again, I said, I'm not making this policy decision, thankfully. And so whatever that decision is, we will, in a period of time, figure out how to facilitate that. So.
Thank you. So just to clarify, you mentioned that you're still requiring masks for all the indoor activities, regardless of vaccination status.
Yes, and that is across the board. So anyone, the current county mandate is anyone over the age of 2, right? And then anyone that is not able, I mean, there are exceptions to that, of course, but we don't run into that very frequently. And that includes people who walk in off the street and don't have a mask, but they need to use the restroom. We are, you know, giving them disposable masks. So we are diligent about that.
Thank you. I'll invite Vice Mayor Dorman and Councilmember Knight to have additional comments, and we're going to wrap this up. We have a lot more business to take care of tonight. Vice Mayor.
Thank you. Thank you, Director Holland. That was very, very helpful. I really appreciate it. I know you're in those classes every time, and I thank you all for that. Before I ever got on council, the mayor asked me to come and sit with him, and he offered to answer some of my questions. And one question I didn't ask because I didn't know to, he answered anyway. And he said, when the vote is 3-2 or 4-1, the vote is the vote, and we all support it. And I'll tell you one thing that is simple, and it's counting to 3. So I see 3. We've, in my view, although we haven't voted, we have made a policy decision. I am absolutely happy to abide by it and go on. And I know us, I know how we do business. If there is a time that we need to revisit this, we will revisit it. And so I think, you know, Councilmember Knight also may have something to say, but that is my 2 cents on where we stand right now. And I thank you all, including our staff, always for this great discussion.
Thank you. Councilmember Knight.
Thank you, Mayor. And thank you, Mayor, for asking Director Holland to answer some questions, because she's the person that's really that works with people that I was addressing my questions to. So my quick question to her is, my purposes are not to try to create programs that mandate vaccinations but really to look out for those that want to participate in programs that have concerns about their health. And so their rights in terms of being able to want to participate too are as important to those that may have issues or concerns about vaccinations. Do you find from your experience that you've talked to people that do not want to participate in our programs unless there is proof of vaccination? Is that affecting the participation rates?
I just want to point out as well, I mean, specifically to the Golden Ticket program, when we started the fall brochure, like way back in, June, we were hoping to be fully reopened. And then as the Delta variant, the issues increased, we pivoted quickly. So we actually offer, of our 30 Golden Ticket classes, 16 are offered virtually. So there are options definitely for people who want to still be involved and do different types of classes that are not comfortable coming in person yet. I have heard from two plus one, so three people who said that, I mean, one of them wasn't really, they want to take classes, but they don't want to take them virtually. So it's almost like the reverse. They didn't join Golden Ticket because the classes were virtual and not in person. And then two who didn't join, again, because we are not requiring vaccination. So, but as far as program numbers as a whole, we are seeing the most successful amount of Golden Ticket members that we have had since pre-pandemic. So we have over 150 Golden Ticket members participating in those programs. And I don't, see that has really impacted us, because people will come to things within their comfort level. We all do that. I haven't been to a live music concert with over, a couple people for 2 years. That's my personal choice. And so that's how I choose to protect myself. But there are people, who choose to not come to Golden Ticket in person to protect themselves. And that's the option, that we all have in everything that we do. But what I guess my point is, Councilmember Knight, is that we work really hard to be all inclusive of that. And so it might not be every single class is offered on Zoom as well, but we do our best to have some selection there until we can, resume in person. So.
Thank you, Director Hall, and I appreciate all the work that you do on behalf of the council and for the community. Thank you.
And I thank not only the council, but staff and members of the public that have shared their thoughts on this. As I said, we've seen this discussion happening all over the country and probably beyond. It is a very sensitive and personal topic. And so that's why it's difficult. We have to sometimes have difficult conversations, but it's because we're all wanting to continue to represent our community in the best way we can. Sometimes we just differ on how that plays out. As the Vice Mayor thankfully calculated up to 5, but votes aren't votes until they're votes. But I have heard similarly that it sounds like 3 members of the council are not interested in moving forward, and potentially 2 members did want to move forward. The direction that the staff is looking for is whether we do continue to pursue this item or not. I would entertain a motion, because I want it to be clear and not just an assumption about vote. If there is a motion, either to have staff pursue writing an ordinance related to a vaccine mandate for participation, or if there is a motion to not require a mandate and to continue following county public health guidelines, either side of that
I'll do that
topic. Well, I see the Vice Mayor did raise her hand first.
I make a motion that we do not impose a proof of vaccination requirement at this time. Period.
I'll second.
Oh, sorry, you kind of froze up a bit. Did you put a period at the end of that, at this time?
Yes, I did.
Okay, you froze
We
again.
do not impose.
Okay, it was kind of a critical time.
We do not impose. Yes, it is a critical time. We do not impose a vaccination mandate on public facilities at this time.
I second that.
So motion by Vice Mayor Dorman, Councilmember Dornbecker seconded. Eddie, could we have a roll call vote on that motion, please?
Yes, Mayor. Vice Mayor Dorman,
Yes.
Councilmember Dornbecker,
Yes.
Councilmember Knight,
Yes.
Councilmember Mueller,
Yes.
Mayor Dunbar.
Yes. And so to be clear, because it's one of those no, yes means no, to be clear, we are not moving forward with any further consideration of requiring a mandated vaccination status for activities in our town facilities. And I will add to that, that was the decision. I will add to that, we will continue as appropriate following county and state public health guidelines as we have been doing. So it's not like we're eliminating what we have been doing, but we are not pursuing that additional step at this time. Thank you all for the thoughtful conversation. I do need us to jump back to our public hearing, and we'll see if predictions were accurate about this potentially moving quickly. But I'm going back to item 9A, which is a public hearing on municipal code update, zoning and design ordinance, introduction and waiving of the first reading of the ordinance number 21-502, amending the Yountville Municipal Code to amend the zoning map to designate the properties located at 6468 Washington Street, APN 910-011-507, and 6424 Washington Street, APN 910-011-474, with the senior mobile home park overlay -S. This is a public hearing continued from our September 21st meeting. So
can we take a 5-minute break?
Oh, I'm sorry. Yes, you're right. You had requested a brief break. So before we get into the revisiting the staff report, we will take a 5-minute break. I see the time at 5:03. Please be back. We will begin again at 5:08. So hopefully people are returning. We're just about ready to reconvene. Hopefully the whole council is back.
Mark this day, 5:07. 1 minute early.
It's a 1 minute warning. Okay, I think Samantha, you all set back up? Eddie, ready? Okay. Let's reconvene and go back to our public hearing, item 9A. I read the introduction, and we were about to hear an updated staff report to get us back into this hearing that was continued from our last meeting.
Good evening, Mayor and Council. As you know, the town has undertaken a multi-year effort to do a comprehensive update of the zoning ordinance and design ordinance. We call that the zoning ordinance update. And as part of that process, there's been quite a bit of renumbering of existing sections. And that is what happened with the senior mobile home park overlay. It was renumbered, but it is unchanged from the existing provisions and will remain the same. It's been in place since the year 2010, and it applies to the 2 mobile home parks, and it imposes a senior age restriction on occupancy. And with the senior overlay, we are suggesting to add it to the zoning map, just as we have added all the other overlay zones to the zoning map. And the reason to do so is so that the map offers a one-glance stop for information on the districts that apply to a property within certain boundaries. It is really a cleanup effort of the oversight of that overlay never being added to the map. When this item was first agendized for the September 21st meeting, there was some concern amongst residents as to what this action would really mean. So it was continued to tonight's meeting to allow staff to reach out to those residents. And we drafted the letter that is attached to the staff report and shared it with all of the mobile home park residents, ownership, and management. And I can say that I've received a positive response from many of the residents who had initially sent letters of concern, stating that the letter sort of resolved all those concerns, and they understand what the action is now. So staff's recommendation is that you conduct the introduction of the map tonight to add the overlay to the 2 senior mobile home parks. The town attorney is here to answer any questions should they arise, and we also have our Zoto consultant, Bob Brown, who's been with us throughout the process, if you have questions.
Yes, I saw Bob join us. Thank you for being here again, Bob. One technical question, Gary, I wanted to make sure I did not open the public hearing originally last meeting, correct?
Correct.
Right, so we'll be opening it for the first time, not continuing the hearing itself. And just to be clear again, Sandra, when you're saying adding the overlay map, it is not a new map. I want to just be really clear. It is an existing map that's been in place for about 11 years. It is not changing anything. It's basically cleaning up the paperwork and moving it to a different part of the file, if for lack of a better term. Is that an accurate way to put it? That in place? Yeah. Yep. Okay. Councilor Dornbecker, your hand is raised. Is there a question?
Yes, thank you. Thank you, Sandra. As I remember last time, the objections from a couple of the residents included, it seemed to me, an objection sort of indicating that they felt that the overlay on the map would cause the property to be diminished in value. Is that true, or has it, since it's been that way for over 10 years, has that caused a diminishment in the value of the land there?
I am not aware of that, but the overlay has been in place for 11 years, so the action tonight would have no impact on whatever that overlay already contains as to the senior occupancy requirement.
I just wanted to make that point that, you know, this isn't changing anything. Anyway, thank you very much.
And just to follow up on that, that's the reason this was put on consent and meant to be an administrative cleanup from the very beginning. It was, you know, the unfortunate spreading of misinformation to some park residents that felt like things were changing. Things are not changing. This is a paperwork cleanup is all it really is. We're not trying to say it that and then we really mean something else. No, that's not how we operate. We're being very candid. That's why we delayed this for 2 weeks, to make it even more explicitly clear that all this is cleaning up our record. Gary, I don't know if you can speak to the concern about what deed restriction, the impacts of deed restriction in general have. I suppose in one sense they add value, in another sense they could limit the number of people that would qualify to live in a mobile home park with an age restriction.
So for clarification, we're speaking about deed restrictions. So you're speaking about this zoning map and the zoning ordinance that's on the council agenda tonight?
Yes.
Yeah, so it's difficult to quantify the effect on value generally. Having certainty in the rules certainly provides value to current owners and renters and those who are leasing there, and also owners of the park. I'm hesitant to speak to the exact impact on value, but as the planning and building director mentioned, these same rules have been in place now for 11 years. So the action tonight of the town council is not going to affect the value. Okay, thank you. Again, full clarity, transparency, as much as possible. Okay, and are there any other questions of the staff report from the council? I don't see any hands raised. Eddie, did we receive any public comment on this item? And actually, when I asked you that question, I believe we carried over public comment previously. So Gary, explain how, should we identify from whom those comments came, or do we need to read those in the record? Because it feels like the opposition that was presented in those comments has been explained and mitigated. And so I think those comment letters are included in the agenda packet before you tonight. Those were submitted at the previous meeting before the current teleconferencing rules for this meeting were in place. Certainly those folks knew the meeting was being continued tonight and had the opportunity to participate and resubmit comments. So I think that's at your pleasure. Those comments have been submitted under prior rules, and those folks who are participating tonight have an opportunity to provide comment again or different comment.
Thank you for that clarification. And I think that's an important point, that we do have a mechanism in place to have live comment. So thank you for that clarification. And we do have, again, to confirm that, we have some email correspondence that came in the previous meeting that will remain part of the record for anyone that wants to review it. But I do believe that the concerns expressed in those comments have been explained. And as Town Attorney just mentioned, there is not further comment coming from any members of the public tonight. So with that, I do need to formally open the public hearing. So I'll do that since we just finished.
Before you continue, we did receive one email today.
Okay, so hold on. Let me open the public hearing so we can include that in the actual hearing.
Okay.
So formally opening the public hearing on this item following the staff report and questions about the staff report. So now the public hearing is open. I'll invite our deputy clerk to read public comment on this item.
Thank you, Mayor. And this is coming from Jack Forchalati. And it states, I am a resident of Bella Vista Mobile Home Park. My concern in the letters you sent out to try to explain this overlay map. The last sentence before your conclusion reads as follows. Federal and state law explicitly governs occupancy and the town. Land use authority extends to use rather than ownership. For these reasons, the YMC governs occupant too. My question is as follows. What are the YMC occupancy rules? Do they govern how many people can live in the mobile home? I have no idea what these rules are that you are stating in this overlay map that we'll cover. Thank you for your time, Jack Forchalati.
Thank you. So I think we have 4 people that are going to want to answer this question. So I'm going to start with Sandra, invite Bob. We'll get to Steve if you need to, and Gary if you need to correct anything.
Well, I responded to the resident today. He emailed me as well, and I let him know that the YMC occupancy rules require a minimum of 80% of the units be occupied by seniors, that it does not limit the number of people that can reside in the home, and that furthermore, the YMC does not regulate ownership itself. The different treatment of occupancy versus ownership is really based on federal and state laws that already regulate that, and the town attorney is better poised to answer those questions, but I believe that is it in a nutshell.
Thanks, and I see Bob has already unmuted himself, so if you had anything further you wanted to add?
I have nothing to add, thank you.
Okay. Gary, did you have anything? Oh, actually, I was going to go to Steve and then to Gary. Steve, did you have anything further or no?
Sandra's addressed it. We do not actually get involved in the number of people residing in an individual trailer unit, I should say. That I think was the genesis of the question.
Okay, thank you. Anything further, Gary?
And just to add that the Yountville Municipal Code, which mirrors state law, as it must, says that at least one person occupying the unit must be 55 or older. State law says that is as far as the municipal code can go. So it does not regulate the number of folks in each unit, and it contains the restriction that state law allows.
So I'm going to add one thing, that there seemed to be a misunderstanding that every resident living in every unit had to be 55 plus, and that is not the case. Gary?
That's correct. Yeah, there are exceptions to that rule for family members and caregivers under state law as well.
Okay, thank you. So Eddie, is that all the public comment we've received?
Yes, Mayor, that's all we got.
Thank you. So seeing no other public comment, I'll close the public hearing and invite council to have any further discussion or potential action. Anyone like to comment or make a motion? Councilmember Moeller. You're muted, please.
Too many buttons. I'd just like to make a motion if you're ready, Mayor.
Yes.
All right. Let's see. Public hearing. Just wanted to get to our resolution. Is there? No, we don't have a resolution. We're just approving the design and review updates. Correct?
No, this is the introduction and waiving of the first reading of this ordinance.
Okay, then I'm on the. I would like to introduce and waive the first reading of the ordinance, and the ordinance name is. So I open this. This is a Town of Yountville ordinance number 21-502, an ordinance of the Town Council amending the Yountville Municipal Code to amend the zoning map to designate the properties located at 6468 Washington Street, assessor parcel numbers 910-011-508 and 6524 Washington Street, assessor parcel number 910-011-474 with the senior mobile home park overlay.
Thank you.
I'll second.
Okay. Motion by Councilmember Mueller, second. Councilmember Dornbecker. Eddie, voice vote, please.
Yes. Councilmember Mueller?
Yes.
Councilmember Dornbecker?
Yes.
Councilmember Knight?
Yes.
Vice Mayor Dorman?
Yes.
Mayor Dunbar?
Yes. Thank you. And again, thank you, Sandra and the rest of the staff that reached out to help clarify this issue. We didn't want to rush into doing what we felt was a fairly simple administrative item, but we want to make sure people truly understood what was happening and what was not happening. So thank you. And we're gonna keep loading up Sandra here on her last official meeting, I think, since we did cancel our second meeting this month. So I guess this is it, Sandra. Here we go. And it's only taken us 2 years to get here.
Yes, indeed. This one is pretty exciting. This is the second reading and adoption of an ordinance that amends Title 17, which is the zoning ordinance. It repeals Title 18, the design standards, and it incorporates those standards very thoughtfully into Title 17, so it's much easier to use. And then there are associated revisions to a number of other titles of the municipal code that were triggered by changes that we made to the zoning and design ordinances. This item was unanimously voted to receive introduction and first reading at the council's meeting on August 3rd. And at that meeting, there was a request to make 5 changes. And we've outlined those in the staff report, and they're highlighted in yellow in the attached ordinance, but I'll quickly touch on those here. The first is to the 3 single-family residential zoning districts. We clarified that the 50% rule limits the number of structures that exceed 1 story. And what this change does is establish that a maximum 1-story building height of 20 is established for purposes of determining whether the exception provisions apply. In both the PF, the public facilities, and the PC primary commercial district, and those are the 2 districts where the town council can consider limited 3-story buildings. We provided a notation that the town council may provide examples of what constitute a substantial community benefit by resolution. And the reason we did this was to put applicants on notice that there are additional uncodified provisions that regulate 3rd stories. On page 129, we modified the parking requirement for emergency shelters, and that was consistent with the verbal changes presented at the meeting. To page 144, we added a new provision that murals will first be considered by the Arts Commission before they're decided upon by the ZDRB. And finally, on page 154, we clarified that the number of exception categories is to the limits on the number of structures and residential districts that can exceed 1 story. And tonight you have before you the second reading of that ordinance. If adopted tonight, it will go into effect 30 days later, and soon we will have more comprehensive and easy to use rules. Thank you.
Doesn't that sound appealing? Yes, question, Vice Mayor Dorman.
Oh, Director Liston, I could not let you go quietly into that good night. I have to have one more question. Senate Bills 8, 9, and 10 that sort of came about as we were finishing this up and have been signed afterwards. Do they have any impact that we should look at now on either inclusionary housing, density bonus, anything like that?
So we were aware of those bills when we were crafting these provisions. And for example, duplexes was one of those 3 bills that you just mentioned, and we already modified the standards to address that. We do have a town attorney opinion of this week that we will look into in more depth and determine if any additional changes are necessary based on those finally becoming law. But we did anticipate quite a few items coming down the pipeline. And Gary, I'm sure, has some additional input here as well.
So I think the question is whether or not SB 8, 9, and 10 affects the ordinance that's before you this evening for second reading.
That's correct.
So by and large, the law applies for residential units, and that's something that exists now and will continue to exist under the ordinance that you're adopting this evening. There's limited things that the town can do. Some of them have to do with lot size and build out and FAR and the like. Given the size of the lots in town, there might not be much movement that's available there. But those are discussions that we're having with staff and that we can continue to have with staff.
Great, thank you. And really, it was a pleasure to work with you, Sandra, on this. It was quite an exciting journey, you and the entire staff. So thank you so much.
And I'll just follow up, and maybe Sandra or Gary can correct me if I'm wrong about this. Vice Mayor, we also have language in there that basically says, as state law changes, we have to change it. You know, we can't be out of compliance with state law. So if you know, there's very possibly going to be new legislation coming forward in years to come that would require us to amend as appropriate in order to comply. Sandra, would you say that's accurate?
That is accurate, yes. We're always looking at the laws coming down the pipeline, and we have to modify as needed.
Any other questions from council? We've got to call on Bob, because we're not going to let you off this easy, Bob, just saying you have nothing to say after all this time. If you could maybe just briefly summarize why all this matters. You know, this very lengthy updating of our ordinances, eliminating some, amending some, and certainly tightening up how all these rules are presented. Could you just express what does this really mean to us?
Sure. Thank you, Mr. Mayor. Yeah, you know, Yountville, like all city zoning ordinances, over time becomes sort of a real mishmash in terms of amendments, et cetera. And they get out of compliance with state law. They become convoluted, and also times change in terms of, you know, what land uses are acceptable, et cetera. And so this was an opportunity to really fine tune the code, to eliminate things that were duplicative or nonsensical at this point, and to really streamline the code, bringing 2 of the ordinances together in one title. And I think that both the new code is going to be great for both decision makers and the public, be much more understandable, and it's going to be a lot more efficient for the staff to administer. So I think in years to come, you'll really appreciate the upgrades that you've made here.
And we'd like to believe this didn't drive Sandra to her retirement, but it may have had some expediting factor. So you don't have to comment on that one, Sandra. But I do, before we move forward with action, hopefully, recognize Kimberly Cook and Stephen Miller from our Zoning and Design Review Board, who spent just as many hours as the Vice Mayor and I, and Sandra and Bob, and often Steve, and even others in our planning department over the many, many months that we have worked on this. So thanks to everyone to help us modernize, update, clean up, and everything with these laws. It's going to be much more efficient for the public to understand what the rules are, and also for our staff to implement them. So Kirsty, you really lucked out. You get handed this nice, clean, updated binder. So lucky for you. But you were back in the days when you were helping create these laws in the first place, I guess. So full circle. But I don't see any other hands. Or did I already ask about public comment?
Did not, Mayor, but we have not received any new comment related to this item.
Okay, thank you. Seeing no more discussion, I'll entertain a motion. I would invite the Vice Mayor, actually, who was part of this process, if you would like.
Oh, thank you, Mayor. I would really like that. So I move adoption of ordinance number 21-501, amending titles 6, Animals, 12, Streets, Sidewalks, Public Places and Parks, 15, Buildings and Construction, 16, Subdivisions, and 17, Zoning, and repealing Title 18, Design Standards of the Yountville Municipal Code.
And I would like to second that with thanks to all of you, but especially heartfelt thanks to Sandra. We're going to miss you.
Thank you. So motion by the Vice Mayor, second Councilmember Dornbecker. Eddie, voice vote, please.
Yes. Vice Mayor Dorman?
Yes.
Councilmember Dornbecker?
Yes.
Councilmember Mueller?
Yes.
Councilmember Knight?
Yes.
Mayor Dunbar?
Yes. And congratulations on that unanimous approval. Great work by a lot of people over a long time. So let's not do it again anytime soon. Okay, moving on. Next up is our, we had some interviews earlier today for some vacancies on our Yountville Community Foundation board and our Napa Valley Transportation Authority Citizen Advisory Commission. And so I would like to invite our, let's see, I think we're going to start, who are we getting the report from here? Is this going to be Eddie?
Eddie from me, Mayor.
Go ahead.
All right. So the town staff posted a notice of vacancy on August 9, 2021, and throughout the town's locations. At the close of the application filing period, we received 2 applications, one from Sandy Fagan, resident incumbent, and Jessica Penman, who's the Yountville Chamber of Commerce incumbent. So the town council earlier today interviewed both applicants, and it was unanimously decided to reappoint both of them to their positions, which will start on August 1st, or which started and will end on August 1, 2023.
Thank you. Any questions or follow-up from any members of the council? So is there a motion to appoint Sandy Fagan and Jessica Penman?
I so move.
Thank you. Is there a second?
I'll second.
So motion, Councilmember Dornbecker, second Councilmember Knight. Voice vote, please, Eddie.
Yes. Councilmember Dornbecker?
Yes.
Councilmember Knight?
Yes.
Councilmember Mueller?
Yes.
Vice Mayor Dorman?
Yes.
Mayor Dunbar?
Yes. I want to thank, as we all did in our interviews with Sandy and Jessica, thank you to both of you for your continued commitment to serving in this capacity for Yountville. So very much appreciated. Eddie, I think you're still up.
Yes, I am. So next we're gonna go to MBTA Citizen Advisory Commission. The council today met to discuss this position, which the town has been unable to fill since 2020. Now, on September 10, 2021, an application was submitted by Scott Owens. Mr. Owens was interviewed by the council, and after the meeting, the council unanimously decided to appoint Scott Owens to the position.
I'll entertain a motion to that effect.
So moved.
Second.
Motion, Vice Mayor Dorman, second, Councilmember Dornbecker. Voice vote, please, Eddie.
Yes. Vice Mayor Dorman?
Yes.
Councilmember Dornbecker?
Yes.
Councilmember Knight?
Yes.
Councilmember Mueller?
Yes.
Mayor Dunbar?
Yes. And thank you to Scott Owens for returning into this role that he served in previously, and we very much appreciate his perspective, and thank you again. Okay, moving on. Let's have a water conservation update for September 2021. Mr. Ferens. As soon as we can hear you.
That darn button. Thank you, Mr. Mayor. As soon as I share my screen, I will be off and running. I assume you can see.
Yes. Yes.
Yeah. Okay. This is my, thank you, Mr. Mayor and council members. This is the October meeting reporting about September. And as we go through this slideshow, you'll see that the tone and tenor is changing as our situation becomes more dire and our actions need to become more urgent. So jumping right in, just a reminder, this was just published on September 28th. We are in the middle, literally, of an exceptional drought, and we're in the worst case of that part of California. I found the drought numbers also published on September 28th for Napa County, and essentially the bottom two left boxes say that all of the 100% of the people in Napa County are affected by the drought. It's the 44th wettest August or driest August in the past 127 years, and the 8th driest year to date since in 127 years. And we're 11.54 inches below normal right now. So what that means to Yountville is we need to reduce our water consumption and try to conserve. And this month that you see before you, this is September 2021. Last year at this time, we consumed 52.13 acre feet. This year at this time, for this month, we consumed 48.34 acre feet. So that's only a 7.27% reduction from our 20% goal. The Rector water use, this slide changed a little bit. What we did was, if you'll remember on the previous slides, the target was a straight calculation of 400 divided by 12. And what you'll see on the next slide is part of our data analysis. But what we did was look at our water consumption since 2010 and did a weighted average to adjust for the season. So the numbers you see here aren't that straight number. They're more fitting with our trend since 2010. However, given that trend, we're still exceeding it, and we're exceeding our seasonal targets right now. And we're at 142.89 acre feet of Rector water, which is 35.7% of our 400 acre feet. And we're only at 25% of the time. So the seasonal variation will help that, but it won't help us enough, I don't think, as you'll see on the next slide. So the next slide, what in response to your question, Mr. Mayor, last time, is how does 2021, the pandemic year, compare to prior use? And so the table that you see before you has, it's a fiscal year breakdown, but it has from 2010 to 2022, and then our totals for each of those years. And as you can see, through the course of the years, none of those are even close to 400 acre feet. So this is a daunting challenge for us. There are two numbers that are an anomaly here that have parentheses around them. 1617 and 1819, we had to turn Rector off for extended periods of time for repairs to our system or repairs to their system. So they don't reflect the full purchase from Rector for those 2 years. So that's why those numbers are lower. Even in 16, 17, the number exceeds 400 acre feet. And then these are the September uses from those years. The one bit of good news in all this is our September use is actually lower than the others, but it's still exceeding our trend. So what we also see in this data is 549 acre feet last year, which is kind of in the middle or the mix of our year uses since 2010. And then the other thing that stood out to us is in 15, 16, 17 were our best years of conserving. But even in those best years, we were still well ahead of 400 acre feet. So the challenge is before us. This is a reminder that we are in a phase 2 water shortage emergency, and the rules that are in place right now, we're reaching out to everybody with door hangers and phone calls and communication as best we can. We're using our Beacon ion water to monitor situation as well as observe conditions in the field. We want to remind everybody, if you have a single meter serving your home, you're limited to 450 gallons per day. If you have a single meter serving 2 units, that number goes up a little bit, but not much. If you have a dedicated irrigation meter, you're limited to 40 gallons per day per 1,000 square feet of irrigation that you're doing, which is designed to keep the plants and vegetation served with water, but not necessarily overwater like people tend to do. Reminder that odd number addresses are Tuesday, Friday, even number addresses are Monday, Thursday, and there should be no irrigation Saturday, Sunday, and Wednesday. So if we're seeing that, we've got to get people to change their behavior. The other piece of it is we can only, the grass strips that exist between the sidewalk and the parking lot, we don't have a lot of them, but we have a fair amount of them. They can only be irrigated with drip systems. So we're trying to get people to be aware of that and convert to either different water efficient landscaping and drip systems, or at a minimum drip systems. The other commercial end of this is hotels and motels are required to display that notice that people can reuse towels and linens as needed in order to conserve water. So what we want people to do at this point is check your irrigation controller, learn how to use it, and check it for the right days. And just because it might be programmed for the right days, you are still limited to the 450 gallons per day. So the irrigation you're doing has to fall within those parameters. Talk to your landscape service if you don't know how to operate your system, or if they're operating it for you, to ensure that they understand. Their job is to keep your lawn green, and they might not understand or know the rules, and they might be running the irrigation system to fulfill their goal of keeping the lawn green. Watering on the correct day is good. We're encouraging that, but be aware that you may be applying too much water. So be aware of how much water is going in those intervals. And also be aware that we still have the Cash for Grass incentive and the Flip Your Strip incentives out there to convert water intensive turf to less intensive water efficient landscaping. So from the town's perspective, this is happening, current conservation and level awareness is inadequate. The greater action is required. We're not going to get there from here right now, the rate we're going. So actions that the town is working on, I'm working with Gary on some revisions to Chapter 13, the water system in the municipal code, to address some enforcement actions that could be better. We are ramping up our outreach. We've given outreach courtesy notices to people with parking and median strip properties. We're going to provide letters and deadlines to get those converted. One big ticket item is we need to aggressively pursue our serial commercial leaks. We have a fair amount of commercial leaks that we've notified people and there's been inaction on it. So we're trying to get them to understand the size and scale of the problem and get those leaks fixed. We do continue to monitor both on-site and with Beacon software. I'm going to share the Beacon software in a minute. Consequences of this are you're going to get a notice of violation. We're past the phase where courtesy notices really apply. Notice of violation will be followed by a notice to cure the problem, and then fines will apply where applicable. The ultimate consequence of this is we might end up in phase 3 water shortage emergency, which is more strict and more dire than a phase 2. And then the final piece of this is if we exceed our 400 acre feet too early in the season, we're not going to have water in spring or summer, and we're going to go to a dire emergency rather than ramping through the conservation phases and trying to make this happen. So we are encouraging all of our customers to sign up for Eye on Water. I'll give you a quick sample of what that looks like. I'm hoping you can see this screen with, it went away, hold on, bear with me. So this screen right here is a sample of the data that you see as a water customer if you sign up for Eye on Water. What you're looking at right now specifically is the water meter data for Town Hall. So the building that we're in, or I'm in right now, this is yesterday, Monday, October 4th, starting at 1 a.m. till 11 p.m. at night, or midnight to midnight, really. At 3 o'clock in the morning, somebody probably flushed the toilet on the outside restroom. 5 o'clock in the morning, the same thing happened. And then throughout the day, you see our water use here. It's, you know, our biggest day or our biggest hour was 16 gallons at 4 o'clock. But if you're looking at this data at your home, you're going to see spikes where the irrigation is turned on and the gallons increase dramatically and then turn off after an hour or turn off 2 hours. So it gives you an idea of the size and scale of what the irrigation does to your system. I chose this one because I didn't want to pick out any single private property owner's data and show it on the screen. But this is the level of data that you can see. And then if you're really motivated by this, you can switch to the week. So far of this week, Sunday, we had 28 gallons flow. Again, likely the restroom in the front. And then Monday, 90 gallons. One thing to keep in mind that we look at is these hours at 1 to 2 to 3 a.m. are the hours that indicate if you have a leak. If you're at home and asleep through the night, there should not be a baseline flow through your meter. And when that happens, the town get alerted and can see what leaks are out there. So we use Beacon Eye on Water for our advantage to count and monitor leaks that are happening. So right now, as of today, we have 100 leaks out of 844 meters, and they range from small to critical. And we're able to track who those people are, and we reach out to them. The residential customers have been very good and surprised about their leaks, and the commercial customers are a little more challenging. And so with that, I'm available for any questions that you might have, and I will stop my screen share.
John, thank you very much. It's great to get that very clear detail. You know, I know when we talk about acre feet, a lot of times residents don't know what that means, or commercial operators don't know what that means. When you've been able to show very clearly, I think, when we're talking gallons, we're talking when all of a sudden water is running. Shouldn't be happening, like you said, when everyone is asleep, unless there is a timer and then you know it. So really good, clear, albeit concerning information.
Yes.
Yeah, Councilmember Mueller.
Just a quick question for John. I think it's I'm going to be signing up for Eye on Water. All of a sudden, I realize I have to have my water bill and the number. So once I get that, I can plug it in. So it's not quite as simple as just going to the website, but as soon as I get that water bill number, I'm going to do it. Another thing, we did have a small leak here and kind of puzzled us for a while. We bought this flume system that you actually put on your smart meter, and it kind of tells you that you have a leak. But you're monitoring everything for residents. So I'm wondering, thinking we might have a little extra extra money left in our leaf blower ban program. Do you see any value to maybe giving a small rebate for flume, or are you really reaching out to all the residents who have a leak and that wouldn't be necessary?
We're doing our best to reach out to all the residents that we've gone through staff. It's a little bit staff intensive, but we have the utilities guys, and Erica Teagarden's been vigilant about this. We've gone through neighborhoods and looked at blocks and blocks and blocks, and that's by looking at the daily data of people's meters through Ion Water. It generates the courtesy notice that people receive, and then it gives us the opportunity to know that we've given a courtesy notice, and then if their behavior hasn't changed, that we can ramp it up with a courtesy notice or notice of violation, and then go up from there. I think the Beacon Ion Water, I'm not that familiar with the flume system, but I think Beacon Ion Water provides comparable data. The only downside to Beacon Ion Water is it lags by 24 hours. So I can't show you water use in town hall from noon today, but I can show it from this morning. So there's a little bit of lag there, but in general, it's pretty robust in terms of the information that it gives.
Okay, great. Thank you.
Vice Mayor.
Thank you. Thank you for the report. I live in a master metered community, and I did not realize that I had a significant leak, not quote on my side of the meter, but on the Rancho de Napa's side of the meter, until I actually saw water coming up to the top of the ground. And as it turned out, that leak had been ongoing for quite some time. So can you maybe speak to our residents about if they see something, maybe it's not in their own yard, but it's somewhere else, or it's in a, just how to look for some of these major leaks?
Absolutely. In most cases, well, the other restriction that we're in right now is that we're not supposed to be irrigating between or during the day. So you can only irrigate between 6 p.m. and 10 a.m. or likewise, you should not be irrigating between 10 a.m. and 6 p.m. So if you're out walking around and you see water basically anywhere on the ground that doesn't appear to be coming from somebody's flowing sprinkler system, there's a chance that they're irrigating during the wrong times and or there's a leak. Leaks are somewhat difficult to find until they show themselves, and they might be leaking from a pipe here, but they show themselves 10 feet away. But ultimately, everybody can look at their indicators that I think you experienced are pressure differentials. If you had great pressure and then a few days later, all of a sudden your pressure is consistently low, and you call the town and we say there's no system changes, then there's clearly an issue with your own local system. But ultimately, it's sound and sight are the best way to find leaks. You see them first, and or if you're in your house, you might hear them.
Thank you.
I don't see any other hands. John, thank you again for very clear and detailed information. And I appreciate that you gave us that revised comparison that breaks out the times of year and also the historical information. Last year was such an aberration in so many levels that it does help put it a little bit more into context. So thank you very much for that.
Absolutely.
We are going to go from the supply of water to the cost of water. And I invite Celia to update us on our water purchase costs.
Thank you, Mayor. Good evening, and good evening, council members. Today I have a quick update of the water purchase cost for fiscal year 2020-2021. So at the end of each fiscal year, town staff partners with Veterans Home staff to complete the annual true-up and compare the costs of producing water and the cost for treating wastewater. We then use this data to determine the cost per acre foot of water received from Rector Reservoir. It's important to note that this cost per acre foot is maybe not the best representation of true water costs, since it's mainly based on the amount of water received from the Rector Reservoir. So what might be more useful information is to know that for fiscal year 2020-2021, the town was responsible for about 67% of the total cost for producing water from Rector. So the town's share, as reflected in the staff report, was $993,325, which was about 8% more than originally budgeted, but fairly close. The town also purchases water from the city of Napa on an as-needed basis, which cost $24,382 in fiscal year 2020-2021. And this was well over the original budget of $5,000. The town strives to only procure water from the city in an emergency situation due to its high cost. So I do have a small PowerPoint that I will attempt to share, hoping that you can see it. Thumbs up, okay. Sorry, it's probably fairly small, those numbers there, but this shows the change in cost per acre foot over the last 10 years. So you can see how it goes up and down. And again, this is basically based on the amount of water actually received. So you can see this spike in 18-19. This was the result of spreading the total cost of purchased water over a smaller amount of usage, causing the cost per acre foot to be skewed. As John mentioned, I do have another slide that shows some historical water usage amounts. And John, I apologize, this 556 is reflective of the finalized number at the end of the true up, so that we might have a spreadsheet out there that doesn't have an updated number. So I think your slide said 549, a little bit different, but the 556 is as of the true up, so that is the final number. So you can see how it can greatly fluctuate year by year. And just to note, kind of going on what Director Ferns was talking about in our prior usage, the average over these 6 years was 497 acre feet. So it's important to keep in mind, as we know, we're in a year where we have a 400 acre feet allotment. And in the past, we haven't really been down that low. So it is going to take quite a bit of effort. So here we see the effects that these costs have had on the water utility funds. At the time of crafting the current year budget, we estimated that the Water Operating Fund 61 would end in a deficit of about $173,000 at the end of fiscal year 2020-2021. We're actually seeing that at the end of that fiscal year, the deficit may be slightly reduced by about $100,000, but we will not truly know that number until the audit is finalized and we present the financial statements in December. But the outlook is slightly more positive than originally anticipated. And what we do know at this time is that the operating fund still does not have capacity to contribute to the water utility capital fund. So that's kind of the downside of these high water purchase costs. And just to wrap up, in the future, we continue to try to only purchase water from City of Napa when absolutely necessary. Going back to Director Fern's slideshow, if we do get to that dire point later in the fiscal year where water is not available in the spring and summer from Rector, and we do have to try and get water from City of Napa, if that's available, that is a very high cost. So that could be quite detrimental. And we hope that water conservations are enough to keep us within that 400 acre feet, but it is going to take some extra effort. And it is becoming apparent that the next utility rate study may need to focus more on increasing water revenue to help cover these increasing costs of water purchase. So with that, I will stop sharing and would love to take any questions if you have some.
Celia, thank you very much for that update. Are there any questions from the council? No, there may be a day sometime in our lifetimes where water costs actually go down, but not yet.
Unfortunately, no.
All right. Well, thank you very much, Celia, for the update. Appreciate that. And also John, thank you. Moving on to council meeting reports. Nothing terribly pertinent to us from the flood control board meeting today. So I'll skip over that. Is there an update on LAFCO, Councilmember Moore?
Yes, we met yesterday. One of our major items was to approve all the sphere of influence updates that we did for about 5 different water districts. And by the one that this council is most familiar with is the flood control and water conservation district. So similar to the other 4 water districts, we are recommending, or we approved no changes to those. And this Thursday on Cal LAFCO, Napa County LAFCO is in the running for the Mike Gotch Achievement Award, especially in the category of ag preservation. So if you want to tune into our business meeting Thursday at 9 o'clock, you can see how that came out. And I have also been renominated by Napa County LAFCO and for re-election to the board. And so those election results for my 3rd term on Cal LAFCO, we will find out at 8 o'clock on Thursday. So that's my update.
Thank you. Climate Action Committee, there was originally a special meeting scheduled for this Friday, but that's been canceled. The regular meeting date is October 22nd. So we will likely have an update for you in our November meeting. Cal City's update, I'll quickly go through and then see if others have anything. Really has more to do with some legislative activity, mainly from the governor. A bill that Cal Cities was very active with, our Senator Bill Dodd, Senate Bill 556, which is a broadband small cell deployment bill. And there were numerous meetings that I was in with our Cal Cities folks and Senator Dodd and his team. Well, that bill got through all the legislative process, but got vetoed by the governor late last night. And so what was interesting is the governor cited the exact same arguments that Cal Cities had been stressing. While there was some positive of that bill because it was going to bring additional broadband deployment throughout California, as the governor noted, it was restricting local government's ability to regulate where these small cell wireless, they call them facilities, but basically towers and large boxes, would go in our public rights of way. And also it would limit the fees we could charge for the use of our public right of way. So the last thing was it was going to conflict with Federal Communication Commission federal law. And so apparently all those things came together and the governor vetoed that. Don't like to see our senators' legislation not get through, but appreciated his openness to a lot of dialogue and amendment consideration from Cal Cities. I want to also applaud our Assembly member, Cecilia Aguirre-Curry, on Assembly Bill 14, which is basically, it's been called the Broadband for All bill that was signed and is going to help broadband deployment in rural counties like Napa and other lower population counties. That was one of the big concerns, is the telecommunications industry typically likes to go to urban centers where there are a lot of people and they can charge a lot more to a lot more customers and make much more money. It doesn't serve those of us that are in rural areas that have large gaps in Wi-Fi access. So a couple updates on legislation through Cal Cities. Also, one last thing about Cal Cities, the Napa County mayors agreed to appoint me to the executive committee of the North Bay Division. I had been on that for many, many years until my term as immediate past president of Cal Cities ended 2 weeks ago. But the mayors agreed to appoint me to that North Bay Division, and also Beth Painter, Napa City Council member, as the alternate for the North Bay Division. So we join American Canyon Mayor Leon Garcia, who's on the executive team, and also American Canyon Council member Miriam Abadamas, who was just appointed the new second vice president of the division representing Napa County. Any other reports from Cal Cities from folks? I know many of us were involved with the conference. Unfortunately, not everyone was able to attend with public health concerns. We certainly understood that. Roughly 1,900 folks did attend in Sacramento, so that was quite a turnout.
Mayor, I just wanted to mention,
yes, you were there, as was our town manager.
That I attended the first day of the conference and the general session opening, and so it was interesting to attend a couple workshops and to be back at that conference. A lot of good information. So I spent the first day there and went to the general session and appreciated watching you give the award to former Mayor Willie Brown as the past president of the league's President's Council, to an award to former Mayor Willie Brown and Speaker of the Assembly. It was a great event to be there to watch. So thank you.
So you saw that? Okay.
Yeah.
You were out there in the dark sea of people we can't see from the stage.
Yeah.
But yeah, it was really a pleasure to be able to recognize Willie Brown. He's such a personality. Recognizing, he said, I realize that you're all giving me this award for my time as mayor, not my time as Assembly Speaker, because he was not as kind and gentle to cities when he was Speaker of the Assembly, and he readily admits that. But yeah, thank you. And also I want to recognize our town manager, Steve Rogers, who wrapped up his term as president of the city manager's department, and really has also helped represent Yountville and Napa County very, very well. So thank you, Steve, for, again, added all that extra time, energy, and focus above and beyond what we do here. So really appreciated that. Okay, are there any other ad hoc committee reports that I'm missing here? Not seeing any. First off, again, we said it before we got on the air, but Samantha Holland, our Park and Rec staff, volunteers, thank you. Wonderful 43rd anniversary Yountville Days Parade and Festival. Thank you to all the candy throwers and the candy recipients out there. It was really, really great to see a lot of young families. I know that that's often what we see for the parade, which is great. A lot of locals, perfect weather. So great job. We know it takes a lot of work to put on the parade and then the festival to follow. So thank you very much for that. And really, please share that with our entire team, because we know it took a village.
Thank you.
Also,
I will share that.
What's that, Samantha?
I said thank you. I will for sure share that.
Yes. And in the spirit of what's happening through our Park and Rec department, free flu shots are going to be available from 10 a.m. to 1 p.m. on, I believe it's October 12th,
Wow.
Samantha, at the Yountville Community Center. And the county is also going to be providing free vaccine booster shots for eligible residents. And so you have to check your status on the county's website if your age group and your public health status allows you to go get a booster for right now, just the Pfizer booster recipient or vaccine recipients. So those are the reports that I have. Anyone else? Vice Mayor.
Thank you. At the last meeting, you all may remember I raised briefly an agenda item request, and I said I would bring it back this time. Mayor, you did ask for something in writing. I have gotten counsel from our town manager that it would be preferable for me to simply present it And I would like to do that now if this is the time.
Okay.
Thank you. So what I would like to present is a near-term agenda item to discuss the possible creation of a community economic development committee. And that's just my working title for it because it says what I think, it says what I have in mind. A little bit of background. We do have an economic recovery program. I have heard positive comments from businesses. I see this as a way to continue that program, make it more robust and refine it, which is what we said we would do while it remains in effect at least through next June, I believe. I have talked to this sort of general concept with our Chamber of Commerce President and CEO, Whitney Diver McAvoy. I don't think I'm misquoting her to say she's in favor of exploring the idea. I've also reached out to some of our businesses. They are in favor of exploring the idea. We did in June talk about this at our council retreat during our brainstorming of goals. I got a couple of head nods by my recollection. When it actually came though to prioritizing, it was not one of our top 3 or 5 or whatever we did, but we did make a commitment to one another and our residents that we would revisit some things that didn't make the original list. And so tonight, as I've sort of looked at this over the last 4 months or so, we've had a seesaw recovery. We have seen a really even more urgent need for workforce housing, economic diversity to try to move ourselves into a really stable situation. And I think the reason I put the word community in this is I think the pandemic has shown us that we really do thrive when we bind our community together. And by community, I mean residents and businesses. I don't leave anybody out when I talk about that. So what I won't go into the details because of course that would be for council discussion if we can put it on future agenda. But some of the sort of broad parameters I have for our council and community to discuss is the composition of the Community Economic Development Committee. I would see multiple types of stakeholders, government, residents, businesses, housing specialists. I mean, we would be able to put together the team that we thought best could help us move forward. The charge of the committee, again, not mine to say tonight, but I would be interested in giving this committee some latitude to investigate and educate themselves and to be just really creative so that what they would look for and hopefully help us do is take this nascent, not necessarily nascent anymore, but this economic recovery program we have and really help it go forward. So that we can harmonize the economic interests and the resident interests to push us past this pandemic. As we discussed, one program is probably not going to give our businesses or residents everything they need for a robust recovery. The timing, I asked for a near-term agenda item to discuss it, but I do realize that I'm very aware of our staff issues, of how pressed everyone is. So I would think that early on, the task would be more of looking at what has happened, what's good and what's bad about our existing program, and then see if we want to go somewhere else incrementally or otherwise. So again, I understand we won't be discussing this tonight. I'm simply asking for a couple of other council members to nod yes, that we would like to have this an agenda item and explore it further as a council with our community. Thank you.
Thank you. Yeah, I still have several questions about the concept that I don't understand exactly what you mean by economic recovery and involving residents in that. I would certainly want to hear from our chamber CEO directly on how this would fit into what their scope of work is, and also visit Napa Valley. I hesitate to try to create another ad hoc committee of variety of stakeholders until there's a little more understanding of what's the point. To be honest, is it to offer ideas of bringing different new business to town? Is it about how do we support the existing businesses? So I guess there's too much uncertainty for me to say, yes, I think it's really a strong concept. But I guess, discussion and exploration, we could certainly do that, whether we formally agendize it or talk offline and get a better sense. So I'll invite others on the council to share thoughts. Councilmember Mueller.
Yeah, I think those are good thoughts. I would like, at least a generalized kind of umbrella, kind of what we're talking about. I talked to lots of businesses myself, and the first thing they bring up is, extending the current business recovery plan that we have. When, are you going to do that? What are you thinking? Blah, blah, blah. So I would like, a bit of a scope. I thought we decided that the vice mayor was going to put together a plan and at least, work with the town manager, and, he might want to bring in Whitney. I think it maybe needs to go through maybe a preliminary level or something like that. I don't know. Steve?
Well, I would actually suggest it probably makes more sense to start with the business sector and
right. Okay, I'm fine with that.
Talk to Whitney in a little more detail to see where are there gaps that maybe she could get support from this kind of a ad hoc committee if there are needs for it, and to get our business sector get their perspective on where can they benefit from support. Steve?
Just a point of order, Mayor and Council. The council protocols require that the council provide some level of concurrence that this is an item that you want further discussion and staff work on. So I'm going to offer a couple ideas, and they're just simply ideas, but one of which, since you're talking about staff involvement and engagement, I think the first step might be for the council to put this on for further consideration, so that one, the vice mayor can put an outline together, perhaps have more detail that can go in the agenda packet, and then the council members would have a better idea for questions that they might have of the vice mayor regarded to the specifics. Because right now we're in a catch-22 where this is the process to bring the idea forward, but we're moving to ideas about how to get information and whatnot. So I'm just offering it as sort of a two-step process, because then the council could hear a presentation, invite the chamber to discuss the concept, and then if there's an interest, then you proceed further. So I mean, that's just kind of a procedural reminder on how this is, but in general, the guidelines are we're not to pursue a lot of staff resource and allocation work unless it's something there's concurrence from the council. So that's what I'm looking for.
And I understand, and that's why I was suggesting that if the vice mayor wants to reach out to Whitney and any other business leaders, like I said, Visit Napa Valley, there are a lot of folks that are already doing this kind of work, and I'm just wondering where the gaps might be that we're trying to fill here. So I did see Councilmember Knight's hand raised, and then I understand Councilmember Dornbecker has a real hand up, but Councilmember Knight.
Thank you, Mayor. I support the Vice Mayor's request because support the town manager's kind of analysis. Because of the Brown Act, it's really difficult to get anything on paper and get it before the council unless we agree to agendize an item. I think all your ideas, Mayor, of the Vice Mayor may be talking to the chamber, and as she's putting it together this report, and so that the town manager can bring it forward is what we should do. We talked about earlier this year about we extended the business recovery program to June, and we told the community that there would be a point where we would talk about its positive impacts and the impacts in the community, and have a conversation. I think the format that the vice mayor is suggesting is a format we talked about we would be getting to early next year and into spring. So I support bringing this back to council. Thank you.
Just to be clear, that's not the format that was used to get the business recovery model that was then copied by everyone else in the county. That was combined efforts from all the chambers and the mayors and the city managers throughout Napa County. And we came up with ideas, and then we were the first to initiate those ideas. So different format, maybe the same ultimate goal of supporting business recovery, but we did not take the same, council and resident-based ad hoc format. So yeah, Councilmember Dornbecker.
Thank you. I too support the idea of agendizing this so that we could bring in the Chamber CEO, Whitney Diver McAvoy, and I think that it's a very worthwhile to take a real look at it and what policies really worked for the helping our businesses through this or recovering from this and learning from those lessons. I think it's really worth the effort to agendize it and have a real conversation about it. And if then we decide to have an ad hoc committee, then do it.
In the spirit of the vice mayor's mathematical genius, there are 3 council members that support it, so we can have it agendized in the future. I would certainly suggest outreach to the business sector, in particular our chamber CEO, so that we're not trying to tell the business sector what we think they should be doing. So, but we'll have more discussion going forward. So Thank you for that. Yeah.
Thank you.
Councilmember Knight, is your hand still up for additional comment or no? Okay. Thank you. Any other business for today? Seeing none, I do want to, again, on behalf of all of us, our entire community, town council, thank you, Sandra, for all the years that you have supported our town and the evolution of our community. I will entertain a motion to adjourn to November 2nd, our regular scheduled meeting, in honor of Sandra Liston's career here in Yountville.
Yes. Oh,
I think I heard the shout of yes. That'll be Councilmember Dornbecker motion, Vice Mayor Dorman seconded. All in favor?
Yeah.
Aye.
Thank you, Sandra.
Thank you, everyone. Good night.
Good night.
Good night, all.